Good morning, everyone. As we open, we wait for our participants to enter the Zoom meeting. Thank you, everyone, for joining us every week. And today is saving time. Winter saving time has changed, so there might be some confusion about the time between the US and the rest of the world. So hopefully we will have as many people as possible. This will be live streamed on YouTube, X, and LinkedIn. And welcome everyone. This is Doctors Against Genocide weekly webinar. As always, we focus on the communities that are suffering from genocide. We are waiting to hear from our colleagues in Gaza. We have not heard from them, especially Dr. Al-Farra, for quite some time, but he promised he will come. Unfortunately, we are also now very busy making connections with our colleagues in Sudan. Fasher has been at the brink of extreme violence that we have not seen before. The brutality that the civilians in Fasher, the brutality that affected the civilians in Fasher has shocked us to the core. The news that are coming from there are horrific. Not only there is actual physical violence with killing and lynching and hanging people, including women, children, and civilians. There is also using starvation as a weapon, attacking the hospitals, killing medical doctors inside, patients inside the hospitals, and even kidnapping medical professionals and asking for ransoms. The political situation in Sudan is extremely complex. We will let the Sudanese people speak for themselves, and we will take a very supportive role as Doctors Against Genocide, as we hear from colleagues on the ground, colleagues who live in Sudan, who lived in Sudan, who are Sudanese, to tell us what is happening to their country and how they want us to be helpful as a global community of medical professionals dedicated to opposing war crimes, crimes against humanity, and genocide. We will also hear from our colleagues in Congo, where we continue to support the communities that are exposed to violence, including sexual violence. We support by providing financial support to get medicine, to pay hospital bills and food, to provide as much as possible to provide some normalcy to their lives and to help them regain dignity and hopefully start education and be able to be independent. We are committed we continue to be committed to relief in Gaza, even though there is the so-called ceasefire taking place there. We continue to hear of occasional bombing, not with the same intensity, but still very scary and very fatal. A few days ago, 100 people were killed. We also know that the aid is not being sent. Only 25% of what is needed is being given. That is what happens when the genocidal entity is in charge of aid. Humanitarian aid should be independent, should be impartial, should be humane, and should not be beholden to the perpetrators. So our work is cut out for us. I hope we will not lose members and we will not lose momentum, because the fight continues. And as we hear more and more of what is happening around the world, we need every single medical professional to be on board with us, because together we can actually make a difference. Not only can we send more aid and support the communities, but also we can affect public opinion, affect policy, change reality, and make the safety and the human rights of every human in the world a paramount priority for all of us. So thank you everyone for being here. And we will start with a colleague from Fasher. Our colleague from Fasher is going to remain anonymous. Unfortunately, what is happening in Fasher is so dangerous that people fear for their safety if they speak up and if they report what is happening on the ground. However, this colleague that will join us today, we have met this colleague, and we actually have defined a project for Doctors Against Genocide that we will work on in Sudan as soon as possible. I will let our colleague tell us about this project, but quickly, I will say something that this is a medical project. It will serve about 40,000 people in Al Tawila, which is close to Al Fasher. And the important thing about it is we will have we will be able to actually provide sanitary facilities to the refugees. As you know, cholera has been a major epidemic or endemic in Al Fasher, and having clean facilities is paramount to stop cholera in its tracks and protect people from this awful fatal disease. Al Fasher, please speak if you don't mind. I think you can speak.
Yeah,
Um,
yeah. Thank you.
yes, thank you so much for being with us.
Yeah, I really appreciate being with you here, and thank you so much for being with us, and thank you for so much for the solidarity and for everything you're doing for us. The problem in Al-Fashir started 500 days ago when RSF decided to put the complete siege on Al-Fashir, on the people that more than 1 million people coming from all over Darfur. And just to let you know that Al-Fashir is the biggest, the capital of the biggest state in Darfur, which is North Darfur. When RSF took over West Darfur, South Darfur, Central Darfur, and East Darfur, all the people escaped and fled out of all of these states and came to Al-Fashir as a safe haven for all of them. When RSF started putting this siege on Al-Fashir, they put them in an absolute isolation from everything that they don't have any access to anything. While the humanitarian aid of the UN and WHO was only 1.5 kilometers away from the people in Al-Fashir, people in Al-Fashir started eating the animals' food and started eating unfortunately, the dead animals' skin. They can find it. More than 1 million people are just barricaded in this place, and RSF put like about 30 kilometers of barricades, so they don't let anybody get out of Al Fashir unless passing through their chickens. And they absolutely killing everybody they want. They kill everybody getting out. So they are trying to escape from death to death until the last week and last Sunday they took over Al Fashir and they started doing that massacres and genocides. You saw everybody in the world see that. In one day, they said that they killed more than 2,000 people. And I think this is not even near or close to the actual number. Because as people from the satellite saw the rivers of blood in Al Fashir, this is the reports coming outside of Yale University labs. They did these genocides. They started killing people for 3 days, and they killed everybody they found escaping Al Fashir or inside Al Fashir, or wounded people and the medical staffs in the only one hospital that have been working in Al Fashir, which is the Saudi hospital for. Um, so they killed everybody there, the co-patients, the patients, and the medical staff. Nobody's out, and now there's no internet connection. Nobody knows what's going on inside Al Fashir. Only few people who managed to escape out of Al Fashir told people what's going on behind them. And they don't know where the others and where their families. In the last 2 days or 3 days, as you said, that they started asking for ransoms. So people discovered that they are abducting thousands of people as hostages in Al-Fashir, and trying to give them very short time, starting maybe from 10 minutes to 2 hours, to call only one person to send them the ransom so they can release him or take him to Tawila, or they will kill him after this very short time expires. This is what's going on in Fasher now. And about maybe 50,000 in the last week reach out to Tawila, which is about 10 to 15 kilometers from Al Fasher. Now, all of these people are in that place at the last safe haven, at the neutral place. And also, it's under access of RSF. So it's very difficult for anybody to talk from there and to tell anybody. So we have a lot of Sudanese. They told us a ransom of collaborative and solidarity between them and the local communities and the international organizations. They started identifying the needs, the direct needs. There's a lot of needs, the needs for food, for medical supplies, for hygiene, and for sanitation. So they started distributing these projects between different organizations and different entities that could cover this, and also started fundraising for Al-Fashir from different areas. Now, I would thank Doctors Against Genocide for take the sanitation facilities. This will target about 40,000 people. Though, like now in Tawila, there is no sanitation facilities. More than 17,000 people using these facilities every day. So we need to do it as soon as possible. And as you said, that in Sudan, we know that the cholera is the highest volume of spread in these areas, in these places, and these circumstances. This is very brief about what's going on in Fashion now. I would welcome any questions and see how could we do this together. Thank you so much.
Thank you so much. We will have a link for donation for this project. This project will need $40,000. So we hope to raise this as soon as possible. The project was presented to us pretty quickly by our colleagues in Sudan. It is very detailed. It shows that they will have sanitation facilities available to 17,000 people on daily basis. We are all medical professionals, so we understand how important it is to wash hands, especially when there is a cholera outbreak, and how important it is to also make sure that there is sewage facilities that are clean and that are safe. So I think this is a project that we all agree is very important. Hopefully, it will save lives and it will be able to get done as quick as possible. Thank you so much, my friend from Al Fasher. We hope to see you again, and take care of yourself and be safe, and we will stay in touch.
Thank you so much. Thank you so much. Really appreciate it.
Yes, and if people have questions, if you can stay longer, that would be great. Our webinars tend to be long. We do have a lot of people who are going to speak today. So if you have time and you can stay, that would be great. One question that came up is, what is the U.S. role in perpetuating this genocide, and can we push the U.S. representatives to intervene effectively? Is that something that you feel comfortable answering, person from Al Fasher?
Yeah. Actually, most of the people in Sudanese diaspora and other organizations working on advocacy have started pushing the Congress on supporting two bills. The first bill is that stop arms sales to UAE, which is the direct funder and supplier for RSF, for using mainly all of the supplies of UAE in killing Sudanese people there. And the other bill was to support Sudanese Peace Act. There are some endeavors started here it started in Washington D.C. just for people to have maybe some sort of agreement or at least ceasefire. But as for now, there's nothing happened. The two bills, the first bill of stop arms sales to UAE was failed 3 months ago, but the representative Sarah Jacobs presented again, and she is getting more supporters. But for now, the United States government or the United States Congress is not prioritizing Sudan on everything, and they have like very large investments and collaborators with UAE, which makes it the UAE lobby is very strong here, so they can't stop this. So if anybody want to participate maybe in supporting these bills or sending to their representatives in the Congress to support the Sudanese bills, that would be very effective and very helpful for Sudanese people. And they all know everything about this. They have shared a lot of reports, and most of the organizations here, the human rights organizations, have sent letters and have sent like multi-signal letters to the Congress, but no actions up to now.
Yes, and we have a day on the Hill on the 19th of November, and we will be looking for these bills and support them by exerting public pressure and having meetings with the representatives. So thank you, person from Fasher. And we will also put I think we should have a letter campaign and put the bills on a campaign for Sudan, inshallah. Okay. I think anything else?
Should
I
we
think
go, Dr. Shahinaz, to finish?
Yes. Yeah.
Yeah. Now we'll go also to hear more about the situation in Sudan from our colleague, Dr. Shahinaz Badri. She is the director of the National Public Health Laboratory in Sudan and the Federal Ministry of Health, associate professor of pathology and laboratory medicine, Ahfad University for Women in Sudan. Dr. Shahinaz, are you there with us?
Yes, I am. Can you hear me?
Yes, we hear you. Yes.
So I'm the former director. That's why I told you my bio sketch has not been updated. I just I was director until early October. I am no longer the director. So I think that our esteemed colleague from Al-Fasher actually covered everything. But I wanted to emphasize further with a little bit of numbers. I received them today from the Federal Ministry of Health, from their Emergency Operating Center, which we hope will help us they have weekly meetings so that we can get some data, because they are officially the hub where overall governance over health over Sudan lies. So in terms of this largest hospital in Al-Fasher, the death count between patients and co-patients, as they say, or patients' families together with them, has been counted up to 460, with deaths of 12 healthcare workers there. There have been an additional kidnapping of physicians, but the numbers are not clear. But there was one physician who was identified as being part of Dr. Mohsen, as being part of the medical corps. He's currently kidnapped for ransom, and they have requested 100 million Sudanese pounds for his ransom. So the other issue is that there is widespread. The other issue is that there is widespread. I'm sorry about the camera. The other issue is that there is widespread fighting in other regions of Sudan or spread of fighting, and information is quite lacking. But let me emphasize, I'm a pretty practical person. I think that people should work on several fronts. Bringing peace to Sudan is important, especially that there is talk in Washington these days. And if you just look into the Sudanese social media, local or international, you will see many messages today about a pending ceasefire. So I believe that as doctors, we swear to do no harm. We're supposed to do all good. We are supposed to encourage and send clear messages so that we can have a ceasefire and to call for an end of hostility towards any health facility in Sudan. All of the health facilities in Sudan, whether they are mobile units by national non-governmental organizations or international or national. For example, in Bara, which is a part of Kordofan and a gateway to Darfur, there was a massacre of 5 medical workers from the Red Crescent. So this is unacceptable that we attack any human being, let alone health care workers, whom we need. They are the helping hands, they are the curers, etc. So this is one arm that people should encourage. The ceasefire should make sure that there are no more attacks. I think just a general ceasefire where aid comes in is great and wonderful because people have been starving in Al Fasher and other parts of Sudan, but in Al Fasher in particular, it has been ignored for, as our esteemed colleague has said, for more than 20 months. More importantly, we have to call a very clear message has to be sent that healthcare institutions, whatever they are, should be respected and safeguarding of these institutions. So if there are, for example, peacekeeping forces that are made of national people or entities within the society, it has to be made clear that it is not acceptable for people to enter these institutions to harm. This message has to be a very clear message. Unfortunately, many times we hear about these things, but there is nothing done on the ground. In actual reality, perpetuators continue perpetuating violence, and this is a war. So this is one thing. The other thing is that there is a health cluster that is rallied locally, and it contains many organizations. I think Médecins Sans Frontières, Doctors Without Borders, is very active, I believe, in Tawila, UNICEF, and other organizations like Sudanese American Physicians Association is also active in Tawila. And Tawila has been a really safe haven for many of the organizations. And I think people should focus on moving also, like we should also be practical in terms of setting up more and more activities there. It's 60 kilometers away. People over there are very cooperative. And so we should work on not just providing sanitary relief, but also, for example, CTCs. Currently, WHO does not have a hub in Tawila. This is an important question. Why don't they have a hub in Tawila? We should ask them to have one there. I know they have in Jinena and perhaps Zalinje and Niala for sure. They have a hub there. But I think we need to do more in areas that are close to Al Fasher to provide the care. So for us, genocide it isn't just the killing people according to racial profiling. It's also more important to understand that it includes gender-based violence. And we need to study this more and identify this more and provide a safe haven for women, whether it is virtual or whether it is in reality focal hotspots where women can come and report that. This is highly, highly important. Why do I say that? Because a lot of gender-based violence has been occurring in areas of Darfur and other parts of Sudan. And this is a tool that I think is also part of genocide. It's not just, we cannot allow this to continue. Aside from the attacks on physicians and so on and so forth, there is also rampant mental health issues currently associated with this war. And you can see it with the vile messages locally. When you speak to people, many people are afraid for their lives, cannot speak out, have mental health issues. And this needs to be addressed and addressed carefully. I know that WHO in particular has worked on, with the Federal Ministry of Health Sudan, has worked on a hotline for that. But I believe that we need to further expand such activities, especially where people have experienced very acute attacks, such as in Fasher, Bara, etc. Then comes the other problem of the association of famine with infectious diseases. As you very well know, not only is this an area that I am interested in as a physician and a laboratorian, but they are highly linked. Sudan has many endemic neglected tropical diseases, but it's also experienced a pandemic of dengue in the last 3 years, and it has heightened during the war. Also, it's important to understand now that dengue has become endemic in the past year or so. And we need to support the country in vector control, in issues of treatment of patients, in risk communication, etc. All 18 states, I believe now in Sudan, have dengue, and more than one state has more than one type of dengue, and that's a very serious thing. So if we just want to stop the war and help support stopping the war, it is because of these diseases: cholera, dengue, multi-drug resistance, tuberculosis, and so on and so forth. The other thing is that with this war, with the advent of this war, many brave doctors have remained and working in Sudan, and we need to recognize that, and we need to talk to them and other healthcare workers, and to understand what their suffering is, what their needs are, and how can we further support them as tools for change in the country to prevent these issues. Finally, finally, I want to talk about the effects of prevention. How can we prevent this from happening again? You know, Darfur, this is not the first time it has experienced this intertribal fighting and killing, but now it's more organized in militias. And this is very, very serious. This is not an easy situation to resolve. And so people have to think of ways and mechanisms to start a peaceful dialogue within the society to prevent that. This role is not just with doctors, it is also with medical anthropologists and medical sociologists and psychologists. We need a multidisciplinary team to work together with us to prevent such things from happening. But we also need to understand these issues very carefully. I think I'm going to stop at that, and then if people have questions, one can give practical answers, operational replies for it. I'm happy to do so. But I will stop here, and as we further engage with more and more colleagues in Sudan, we'll be able to provide a better picture for all of our colleagues in the US and internationally. Thank you very much for inviting me, and I hope I have been as informative as I could be given the circumstances. Thank you.
Thank you so much, Dr. Shahinaz. It comes always to the point that genocide, war crimes, crimes against humanity are a public health catastrophe, and it affects our jobs, and it affects the people that we care for. And Dr. Shahinaz, I mean, you by now you are a Doctors Against Genocide member, and there's no thank you.
Okay.
It is.
Thank you. Okay.
We don't thank each other. We are
Okay.
we are doing all the work that we can do because we care. So thank you for being with us, and inshallah we will continue to hear from you, and I hope we will make a difference. This is what we this is our goal, is to make a difference in preventing what is happening before providing aid, and that is the goal, is to grow and get stronger.
I hope that this can happen. One of the ideas I had, Dr. Karame, and this is for everybody online today and for all colleagues, is how can we work together to get perhaps, if there is a proper ceasefire, to take our message on the ground and to try to go to areas like Tawila and hopefully Al-Fasher itself, and have doctors twin from cities, just as what happened in Gaza happens in Al-Fasher. Many organizations have come and worked, including Samaritan Purse, including SAPA, and so on and so forth, and they still do. But if we have twinning from other cities in the world where doctors can come, membership of DAG or other societies or other organizations can come and support people in Al-Fasher and other cities, even for short visits, pediatricians to help the children, surgeons, internists, public health people, nutritionists, etc. That would be fantastic, and it will send a strong message to the locals, and it will send a stronger message to the rest of the world that this is not acceptable anymore. Thank you.
Absolutely.
Yeah, I think we hope that you can help us maybe organize these missions, Dr. Shahinaz, so we can talk, later about how we can organize. I know some organizations are already sending doctors there to Sudan. One of our colleagues is already there actually, but definitely we need more people. And also Dr. Shahinaz hopefully will be joining us on our day on the Hill uh, this coming November 19th. So in the meantime, we need to develop our advocacy arm for the Sudan genocide situation, so we can press our politicians to mobilize more and try to pressure the parties committing this genocide to stop. We need a ceasefire as soon as possible. We always need to stop the bleeding, and at the same time, we need to help the survivors. So hopefully with your help, Dr. Shahinaz, and our colleagues there in Sudan, let's keep talking, let's keep making more connections to make a difference. We need to stop the killing. We need to provide for the survivors, and we need to protect them. And the needs, as everyone knows from the news in Sudan, are huge. We have a link a link for a fundraiser for our people in Sudan. Please donate to help this effort, and please pass it around to get more help. Again, the needs are beyond imagination. The disaster there is very brutal. Millions of people are left without food, without shelter, at the mercy of these, barbarian killers. And any help we can offer them will make a big difference. Anyone from the panelists have any questions for Dr. Shahinaz, please? Anyone from the panelists?
It's great to have Dr. Shahinaz, and as Dr. Jbour said, she will join us on the Hill. This is an important day, so we're hoping that as many people as possible will come with us. There will be a form that I will put in the chat where you can sign up to join Doctors Against Genocide on the Hill. I'll put it in a minute. Nidal?
Yes.
Yeah. I don't see Faris. Did you send him the link?
Yeah, he's trying to get in, and we had Munder, but we lost him now. But
Okay.
okay.
So maybe we can. Elvis is here, and Elvis is in Congo, so maybe he can give us an update on what is happening in Goma.
Sure.
Great, thank you very, very much. Salam to everyone from Goma. I'm really, really sorry. It's heavily raining outside. I may lose connection in a minute, or I may lose electricity. I'll be very, very quick and maybe just take a few minutes. Last month, the beginning of last month, we were called. The Ubuntu team was called to a location near the town of Goma, where more than 60 women, including 2 girls aged 3 and 6, were all raped in the same night. And we went there, we saw the women, and it was appalling. At that time, we were not financially in the position to help them, even though we did call some international organization to come and help them. But they did just take care of one aspect of their struggle, and that was just the check and other medical bills. They didn't look at the other aspect, that would be mental support or even living costs or the need that they had at that time. So what we did is we spent the last 2 weeks trying to identify everyone. The first day when I went there with the team, their wish was to go back in their villages because it was not safe for them to be there, because it wasn't the very first time that they were attacked by soldiers, by rebels, and that started to happen every week. There will be a group of soldiers who will come and rape women and young girls. So they all wanted to go back to their villages. So this week, this week and last week, we spent time around the location. We managed to identify 83 families who were affected in the last 2 months. And we are planning to hire the transportation buses to send them back in their villages. We have checked with them. They are happy to go, even though we can't promise them that they will be safe where they are going. The only thing that we know, they are returning to locations where most of the houses were burnt. So part of the package that we're going to give to them will be getting them the transportation, a bit of food provision for a week or two, then assess their shelters where they are going, and start to send a team to help them to rebuild the shelters, temporary shelters, so that they can restart the new life. So we've got 83 families that we're going to support, and that will be part of the second grant that we received last week. And the team, the people that we support, we are all grateful, because this is the time we were asking ourselves, how are we going to support the people, especially with the situation in Congo. So that is planned. Part of the packages that we're going to give to them, we'll do the medical check before they go back. There'll be transportation, financial support, and build a shelter for all the families. So we've got 83, as I said. That is one part of the action that we're going to do this month. The second one is the young girls that we are supporting. For the people who are new, we support young girls who have been victim of sexual assault and become mothers. They are all between the age of 13 and 18. We've got this time we've got 10 who are living at the Ubuntu house. So what we did, we rented an accommodation where we are housing them while they are recovering, they are receiving treatment, and also they are rebuilding a new life. They are all young, they need support, and they have to be in a place where they've got the right support. The majority of them are either orphan or don't have any parent who's still alive or any parent who is with them. So we've got 10 young girls and 11 babies. We've got a set of twins, and we are supporting them, and we'll be sharing with you the images. We try not to put them on social media because of their safety, because they were all raped when they were in the displacement camps. The majority were raped by soldiers, by rebels, and we got all the interviews with us, and we tend not to share them, but we can internally share all those content, and then you can see the challenges that we are facing on the ground. There may not be gunshot, you may not hear gunshot in Goma, but women still facing a lot of challenges. We've got 22 now on the waiting list who are in the same age bracket. They are on the waiting list only because they are not yet ready to give birth. So we are supporting them. What we do, we look at, if we meet someone who has a parent or the family and they were victim, we will support the family. We will move them away from the location because most of them lives in outskirts of the town of Goma, and there is no one controlling those places. So it's either the rebels or a group of gang, and that is most of the time, that is where all the atrocities happen. So by the time we meet one, either at the hospital or somewhere in town, we'll move them away from those locations to a nearby location in town where it is safer for them. And also, we move them away from those locations because the international organization have a zone that they cover, and that particular place or those places, the international organization, Doctors Without Border or any other organization doesn't go to those places because it's not safe for them. So what we do is we try to move them to a place where they can have access to the international organization support in terms of treatment or food, because they are living in the area where they are. So by the time we've got a parent who has a child, if we meet another child who is pregnant and they don't have where to go, we will support that family and we will bring the child to live in the family until they give birth. Then we'll move them to what we call Ubuntu house. So that is the model that we use. And once again, the grant will support us to continue providing food, healthcare, and support, especially this support to the young girls that we have. We've got 2 cases. We are waiting for 2 surgery. We've got 2 babies. One was born without a back passage, and we are waiting for the baby to get the right weight. We were told he has to get to 5 kilos so that they can do the surgery. And we went to the ward last week. We're still short, so we were asked to come back after 2 weeks. And all the bill for the surgery go around 500. And we are grateful because at this point we can confirm that we'll be able to pay for the surgery. And the other baby, was born with, I know most of you are doctors, so you will know and you will understand. He was born without gender, so he's completely blocked. There is just a wall that get the liquid out, and we are also waiting. We were told the baby has to get to a year old so that they can see if it's a situation that can naturally improve or they will go through surgery. So we've got those two babies, and they are all in Ubuntu house. The other one that I never ever mentioned to you, when we were based in the displacement camps, that was around January, December, and November last year, we were supporting 350 malnourished children. When the war broke out, the camps were attacked. We lost the majority of them, and we only rescued 32 orphans. And those two were part of the 350. Since February, we rented a house for them. So they are orphans and they live with us. So we did put a structure for them there where we support them also to be close to something that is normal. So we're still supporting those kids. They are amazing. They are beautiful. We love them. They spend the whole year with us until the 1st of September, where we decided to send them back to school. The majority of them who went back to school, who went to school in the past, where the last time they were there was 3 years ago. And the majority is the first time they go to school. At that house, we've got the age bracket is 3 to 13, and we've got 32 children over there that we also are supporting. So your donation, your support is going also to help those 32 children who are orphaned. That is the update that I can give to you today. If there is any question, I'll be happy to answer. Sorry.
Thank you so much, Elvis. I put the link for the Congo. And again, Elvis doubles as a humanitarian, a journalist, and a health advocate. We are very grateful to have him as a partner on the ground in Goma. And all the projects in Goma are very meaningful. We are hoping to build resilience for these young women for no fault of their own have been victimized by the most brutal violence against a woman, which is sexual violence. Having the ability to support them, give housing, and be able to pay their hospital bills and their medications for them and their children, and hopefully allow them to stand on their feet and pursue an education for themselves and for their children is literally life-changing. So very proud of this partnership, and we appreciate Elvis' relentless work in Goma, where he helps his people. Very proud of this, and thank you, Elvis. And we will have you every week, hopefully, to give us updates. And at Doctors Against Genocide, we really try to couple aid with the ability to actually understand reality on the ground. So it is not abstract, it is real. And we make it our responsibility to know, our responsibility to bear witness, and our responsibility to find every way to end the brutality against the people wherever they are affected by genocide or war crimes, crimes against humanity. I think we are seeing our colleagues from Gaza, which is great.
Karama, before we go to Gaza, do you want to hear from Khadija? Khadija, are you there to hear more about Congo? Then we move to Gaza.
Yes, I'm here.
Yeah, Khadija, you've been doing great work with Congo. Let's act together for Congo, along with
Yes, sir.
Elvis for Ubuntu for Congo. Please, yes, go ahead.
Yes.
Give us any updates in your campaign helping the victims of genocide in Congo, please.
Hello, everyone. Salam. My name is Hadija, and I am an advocate for the people in Congo with my organization. It is called Let's Act Together. And we're based in Goma. We are a collective of youth volunteers. And with the support and grant and just the love of Doctors Against Genocide, we've been able to, in the past month, do quite a lot, especially in the way of medicine, provision of medicine, because of the ongoing war. There's sort of a blockade on anything that can really come into the clinics or the dispensaries to provide life-saving medication for the people that badly need it. And when people don't have the access or the funds to get treatment, then the situation becomes it's really terrible. So with the grant that we were blessed to receive, we've been stocking the shelves of dispensaries and clinics in Goma, and also paying medical bills for our community members who are not able to get their bills paid, to be able to leave the hospital. And this month we plan on doing a big project, providing water, because we know the importance of water and hygiene to prevent illness. And so we are going to be boots on the ground, working to provide a reliable water source for the community members, reliable access to sanitary care for the young women and girls who, just because of the conditions there that have completely deteriorated, are not able to get access to these basic things to be able to prevent illness. So an update from the ground, we usually share them on our Instagram. Let's Act Together for Congo. Usually we collaborate with Doctors Against Genocide. And we're grateful. We're truly grateful. And yes, thank you all as always. Thank you for your continued collaboration and support.
Thank you, Khadija. We're grateful for your work too. And it is a shame on humanity that we're having 3-4 genocides going on at the same time. In a way, it's a sign of our collective failure. But I'm really also happy that we're connecting the dots and raising more awareness and educating people. More and more people in the world are more aware of what's happening, that our systems, international systems, are failing, and we in the medical community cannot be just dealing with the victims and the injured people at the back end. It is more of a call for all of us to be more active on the forefront, on the fore end of these crimes, to stop them from happening, rather than have to deal with the consequences. And usually it's too little too late after too many people have suffered, too many people have lost. This is, in a way, this is the whole concept and idea behind DAG, that as a medical community, we cannot just resign ourselves to humanitarian aid without using our leverage, mobilize our colleagues as much as we can to stop these crimes, prevent them as soon as possible, to minimize the impact on the community. As Dr. Karam mentioned, this is a public health catastrophe of the highest order, and we can save more lives by stopping these crimes in Sudan, Congo, and Palestine. Thank you, Khadija and Elvis. Now we have colleagues from Gaza who joined. I'm going to start with Nidal. Nidal is not Nidal, it's Faris Afani, but I have to give him my link to use it because he had some problem connection. Faris, are you there?
حياك الله. سامعيني؟ سامعني يا دكتور نضال؟
سامعينك بس مش شايفين الصورة. So Faris Afani, he's our colleagues from Gaza. He's the head of the EMS services in the north of Gaza that has been completely destroyed, unfortunately. We had him earlier, a few months back, but we lost connection for multiple reasons. In the meantime, unfortunately, Faris lost his son, who was a paramedic. He was murdered by the genocidal Israeli forces while he was rescuing people from one of the apartments in North Gaza. But Mr. Faris is, he's an example of the resilience of the people in Gaza, the resilience of the medical community there, despite all these problems. Now he is going back to north of Gaza, and unfortunately, all the hospitals in the north have been shut down and destroyed. So we have a new project for DAG, and for the people in the north, we want to build a new medical point there an ambulance point, a clinic, rehab area, and some help for the people with nurses. So Mr. Faris is going to be sharing with us uh, more about this project. تفضل أخ فارس.
حياكم الله. السلام عليكم ورحمة الله وبركاته. حياك الله دكتور نضال، وحيا الله ضيوفك الكرام اللي موجودين معنا من أنحاء العالم.
الله
طبعا اليوم أنا أحب أوصل رسالة دكتور نضال من خلال حضرتكم، إنه الآن يعني تم توقف إطلاق النار في قطاع غزة، ولكن المأساة للمنظومة الصحية وللإنسان وللحجر لم تنتهي ولم تتوقف، بسبب ما خلفه من دمار كبير وهائل في قطاع غزة، وخاصة أيضا المنظومة الصحية التي نمر بها في قطاع غزة، حيث هذا العدوان لم يسلم أي شيء من بطش الاحتلال الإسرائيلي، من تدمير المستشفيات والمراكز الصحية، من قتل للأطفال والنساء، وتدمير كل شيء هنا من جميع نواحي الحياة، وأيضا
يا أخ
الخدمات الإنسانية والبنية
فارس،
التحتية.
أبو حمزة خليني أترجم الله يخليك. So brother Faris Abu Hamzi, he is thanking all of you for paying attention and trying to help the people on Gaza. He's saying that despite that the intensity of the bombing has slowed down or much better than before, the genocide continues by all other means. The amount of destruction, the amount of misery that the people are living in is still affecting them. There's complete destruction of healthcare, complete destruction of housing. People are still struggling to get aid. We know that the aid still not getting in at a scale that the people need. Israel is allowing, a few trucks here and there, but nothing as close to the demands of the people. تفضل أبو حمزة.
يعني في الوقت الحالي، وخاصة في المناطق الأكثر يعني تعد منكوبة في قطاع غزة، هي مناطق شمال قطاع غزة. يعني الآن كما يعلم الجميع، الاحتلال الإسرائيلي في المرحلة الأولى قام بوضع حدود بما يسمى الخط الأصفر، والآن هذا الخط الأصفر يقع بداخله اللي هو مستشفى الأندونيسي ومستشفى العودة في شمال قطاع غزة. لا أحد يستطيع الوصول إلى هذه المستشفيين، وأيضا مستشفى مجمع كمال عدوان الطبي هو يعد الوصول إليه حاليا خطير جدا. لذلك يعني المواطنين عادوا إلى منازلهم في شمال قطاع غزة، لكن دون وجود أي مستشفى أو أي مركز صحي شمال قطاع غزة، بسبب منع الاحتلال الإسرائيلي لحتى هذه اللحظة من السماح للمواطنين في ذلك المناطق، وأيضا للطواقم الطبية لعودة العمل في ذلك المناطق. لذلك
خلينا
نحن
نترجم الله يخليك. So the three hospitals in the north, again, we know that they have all been attacked and they're not in service. And to make things worse, that all three hospitals, the Indonesian hospital, the Al Auda hospital, and even Kamal Udwan, are in the area that genocidal Israel has designated beyond the yellow line. So people have even no access to get to those to try to rehabilitate them, even if they wanted to. This leaves that the situation on the north of Gaza in a very dire situation. It's much worse than the rest of Gaza. There is not a single medical point or medical facility in the north to help the civilians who have been trying to go back to their homes and whatever left of their homes in their areas in the north. تفضل.
لذلك دكتور نضال وضيوفك الكرام اضطرينا لإنشاء بعض النقاط الطبية في شمال قطاع غزة، حتى يعني نعزز من صمود أبناء شعبنا الفلسطيني الذين ذهبوا أصلا إلى منازلهم المدمرة. فلذلك يعني شمال قطاع غزة كما تحدثت الآن معدومة بشكل كامل تقديم هذه الخدمة الصحية في شمال قطاع غزة. لذلك نحن يعني في مؤسسة الفرسان الفلسطينية للطوارئ أنشأنا نقطة طبية تقدم خدمات العلاج الطبيعي، وهذا القسم مهم جدا خاصة بعد توقف إطلاق النار. وجود عدد كبير الآلاف من المصابين بحاجة إلى العلاج الطبيعي والمتابعة. أيضا سيتم إنشاء في هذه النقاط طب الأطفال وطب العام وطب أمراض الجلدية والباطنة والقلب، وأيضا قسم خاص لتطعيم الأطفال في ذلك النقاط، وأيضا إنشاء مركز إسعاف وطوارئ يقدم خدمات الإسعاف والطوارئ على مدار الساعة. هناك طبعا
So
دكتور نضال.
خليني نترجم. So part of the response that Mr. Faris and his team is trying to do is to establish a medical point in the north where there is no other health services are available. The medical point will provide ambulance services, a pediatric unit to treat the children and provide vaccine for the children, a rehab unit for the people who have been injured and amputated, because now all these people are left to deal with their injuries, but they have not been receiving the right treatment that they need. And تفضل. And also an emergency point to help with urgent cases if they need to. تفضل.
وهنا أركز على العلاج الطبيعي بسبب يعني كان آخر مركز علاج طبيعي يقدم في شمال قطاع غزة اللي هو كان في منطقة الشيخ رضوان. كان هناك داخل عيادة الشيخ رضوان مركز علاج طبيعي. الاحتلال الإسرائيلي في الدخلة الأخيرة قبل دخول التهدئة تم تجريف هذا المركز، لذلك أصبح الآن حتى يعني شمال قطاع غزة بأكمله حتى أطراف مدينة غزة لا يوجد علاج طبيعي. لذلك يعني بحمد الله يعني باشرنا بإنشاء هذا القسم حتى يتم التخفيف من معاناة المصابين. هناك كما تحدثنا الآلاف يحتاجون لهذه الخدمة. أيضا دكتورنا الفاضل يعني هناك الكثير من الحالات لا تستطيع الوصول إلى المستشفيات في مدينة غزة، منها مجمع الشفاء ومنها السرايا وأيضا المعمداني بسبب عدم توفر المواصلات. المواصلات حاليا من شمال قطاع غزة لمدينة غزة صعبة جدا جدا، يعني يحتاج المريض أو المصاب حتى يصل إلى المستشفى إذا يعني ذهب من خلال وسيلة مواصلات يحتاج إلى ساعتين كاملتين حتى يذهب إلى المستشفى. هناك معاناة كبيرة من قبل المواطنين في عملية التنقل والوصول إلى المستشفيات الوحيدة الموجودة حاليا في مدينة غزة. لذلك هذا المركز الذي يتم إنشاؤه الآن في شمال قطاع غزة هو مركز مهم جدا وضروري جدا إنجازه بأسرع وقت حتى نخفف من معاناة أبناء شعبنا الفلسطيني ونكون نحن يعني أقرب إلى المواطن من أن يذهب إلى هذه المستشفيات البعيدة والوحيدة في مدينة غزة. لذلك يعني في القريب العاجل خلال إن شاء الله أسابيع سيتم إنشاء كما تحدثنا إسعاف طوارئ على مدار الساعة يعمل في شمال قطاع غزة، أيضا على تقديم الخدمات الصحية البسيطة حتى نخفف من معاناة أبناء شعبنا الفلسطيني. وهذا الشيء يحتاج صراحة إلى الكثير من يعني الوقوف بجانب أبناء شعبنا الفلسطيني وبجانب هذه المنظومة الصحية حتى نستطيع استكمال العمل داخل هذه النقاط والنقطة الطبية من خلال هو كما تحدث دكتور نضال توفير الطاقة البديلة حتى نستطيع تشغيل الأجهزة وتشغيل الإسعاف الطوارئ على مدار الساعة. وأيضا اللي نحاول أيضا من إيصال المياه، أيضا فحر بير مياه. هناك المياه معدومة جدا دكتور نضال في هذه المنطقة، منطقة شمال قطاع غزة هي معدومة تماما المياه، لا يوجد مياه. فنحن صراحة من باب تقديم أيضا الخدمة الصحية نحتاج تقديم أيضا الخدمات مثل المياه وحاجات أخرى حتى نخفف على الإنسان كاهل هذا العدوان من عامين من القتل والبطش والتدمير. فلذلك هذه النقطة تعزز من تواجد أبناء شعبنا الفلسطيني في شمال قطاع غزة، وتخفف من معاناة المرضى الذين كما تحدثت يستقلون في ظل انعدام المواصلات بشكل، يعني خلينا نقول 80% معدوم المواصلات عندنا بعد تدمير عدد كبير من المركبات.
Yeah, thank you, Akh Faris. Brother Faris is again emphasizing the importance of having this medical point to the north, because the people who made it to the north now have no access to any healthcare. The closest place they can go to is Al Shifa Hospital, but that requires almost 2 hours of traveling. Even when they manage to get a way to go there, most of the time they don't have the means to get there. That's why this is important to have at least a stabilization point, an emergency point. Uh, what they are asking us, Brother Faris and his team, is they're asking DAG to provide them with the funds to cover a solar energy panel so they can function in this unit. They don't have energy, so we need to buy them a solar panel. I think the cost of this is also, as he mentioned, he gave me the company is about 40,000. Sorry, the cost of this is about $25,000 for the solar panel. Also, the area in the north, they don't have water, and the point also, the medical point will not have water. So the plan is to dig a well there to get water to provide for the medical point and for the people surrounding it. The cost of that well is about $20,000. So he's already working. Karama, if you're still there, if you want to share the video from the area, they already started the work there. They found a spot. Again, there is not much available there. They're trying to rehab some old damaged structures to build this medical point. But this is something that he and his team are taking care of. Our part as Doctors Against Genocide, we need to provide them with the solar panel, the energy panel, and the funds to be able to dig this water well. That's going to be able to provide for the unit itself, the medical point itself, and to provide for the people, the displaced people who made it back to the north. هلا شفنا صورتك يا ابو حمزه، بالاول ما كانت تبين الصوره. منور. Now we saw his picture. So Abu Hamzi, he's the
حياك الله، حياك الله يا دكتورنا.
chief paramedic in the north. فاحنا المطلوب
حياك
منا اللي
الله.
هو السولار بانل، the solar system for energy, and the well نحفر بير to get water for the people there. Yeah.
صحيح دكتورنا، يعني المشروع الآن اللي بنشغلين عليه، يعني منظومة الطاقة كما يعلم الجميع الآن كهرباء لا يوجد في قطاع غزة نهائيا بعد تدمير البنية التحتية لجميع مقومات الحياة في قطاع غزة. لا يوجد كهرباء، لا يوجد مياه، لا يوجد أصلا يعني صرف صحي في قطاع غزة. كل شيء مدمر صار، خاصة شمال قطاع غزة مدمر بشكل كامل ومنكوب. يعني مهما نتحدث عن شمال قطاع غزة وعن رفح أيضا، مناطق هذا الذي يتحدث عنها بكل ما تعنيها الكلمة، يعني من يرى المشاهد ومن يرى المنازل يعلم جيدا أن هناك تسونامي أو زلزال كبير ضرب هذه المناطق بسبب التدمير الهائل الموجود. لذلك بدون الطاقة البديلة اللي هي اللوحات، والآن يعني الاحتلال الإسرائيلي بدأ يسمح بدخول هذه اللوحات والبطاريات الذي منذ عامين كان يمنع إدخالها. يعني منذ السماح بإدخالها بكميات قليلة جدا، يعني بدأت الأسعار يعني تنخفض قليلا. هي بهذا الخصوص أيضا كما تحدثت، لا يوجد مياه حتى نستطيع الاستمرار أو العمل في هذه النقطة، بحاجة إلى فحر بير وإلى طاقة بديلة حتى نستطيع تشغيل الأجهزة وتشغيل بير المياه حتى نمد المواطنين. أيضا أخي الكريم دكتور نضال والإخوة الأفاضل والأطباء والدكاترة اللي معنا أيضا بحاجة إلى يعني دعم الأطباء والتمريض، وأيضا ضباط الإسعاف والمسعفين الذين سيعملون في هذه النقطة على مدار الساعة. نحن جاهزون بإذن الله عز وجل
خليني
نقدم.
اترجم هاي بلاش ان شاء الله خليك. So again, brother Abu Hamzi is saying that the situation in the north is beyond catastrophic, it's beyond imagination or beyond description. It's completely destroyed. The need for the people who managed to go back there is huge. Uh, so he needs our help with this, establishing this medical point, providing a solar panel for it, digging a well to provide water for the point and the people around it, and most of the people who are in his team who are planning to help, the paramedics, the nurses, the doctors there are volunteers, so they do also need help. So hopefully part of our help for the doctors, our colleagues here, is to support your colleagues in Gaza who are willing to work for free to work in this point. Hopefully we will be able to provide them with some stipends to help them, to help their families, because these people who have, our people have been working for almost 2 years without any pay at all. So part of our obligation to provide for the victims is also to support the paramedics, the doctors, the nurses who are trying all what they can to help. We also have another colleague here from the north from بيت لاهيا منذر. في عندنا الأخ منذر أبو حمزة، هي برضه بيت لاهيا، بدنا نعمل كمان بروجكت بيت لاهيا. So it seems the north is in huge need.
تمام.
يا تفضل تفضل ابو حمزه، اذا حاب تسمع من منذر شوي وبعدين نرجع نسالك كم سؤال اذا ممكن.
تمام توكل على الله
منذر
دكتور.
كيفك منذر؟ We don't see you.
يعطيك العافية أخوي، يعطيك العافية.
هلا.
والله ما في كهرباء ولا في إنترنت، يعني هو شابك على الشريحة الإلكترونية، فربنا
Switch to
يهدي
English
البال.
منذر. You have no excuse. You can speak English انت. منذر.
No, bro. Thank you so much for this opportunity to talk and express the situation in Gaza. Can you see my
Yeah.
face?
No, we saw you before but not now. We lost you completely. Okay, let's wait for him. He will be back.
Nidal, Amr al-Batsh is here too.
Oh, okay. Oh, Amr. Okay. Well, I didn't know who's Mr. Butch. I didn't know who's. You should put Amr عشان نعرفك يا باشا. منذر, are you back?
لحظة السلام عليكم.
أهلا, كيفك أخ عمر؟
كيف حالك؟ شو أخبارك؟
الله يخليك, الحمد لله. So, Amr, أنت you're talking from Nasser Medical Complex?
Yes.
Okay. How's your English, Amr? Do you want to speak in Arabic or in English?
Speak Arabic.
Arabic. Okay. Just give me a minute. I want to hear from Mundir, then I will come back to you. Sorry, Amr, for the delay. Mundir, are you back? Mundir? Yeah, it seems we lost, or he's having problem with his connection, Mundir. Anyway, Mundir is in Beit Lahia. The situation in Beit Lahia, which is north of Gaza, is also very disastrous. Many families try to go back there, but they need help to support them to stay there. One of the projects that we talked about, we want to start a farm, start making some food or planting some food produce for the people. That's another way to help them. Beit Lahia in the north is famous for its farms. They used to plant all kinds of produce. And this is another way to help the people survive and help the people work and provide for themselves. Mondir managed to find an area. He has the land, he has everything. There is actually a well already dug in that land. All what they need is a solar panel to provide the energy to get the water out. So we will be talking to him more and explaining that project again. Amr is located or situated at the Nasser Medical Complex. He's been there for 2 years. Amr, you're a photographer, yeah? A journalist?
صحيح أنا صحفي
So Amr
من
is a
قط...
journalist and a photographer. He's been stationed at Nasser Medical Complex for a few years, and he's been documented all the cases of children and injured civilians who've been at Nasser Hospital, documenting their cases one by one and following up their care, whether at Nasser or when they managed to get evacuation. He has been a great asset to the Nasser Medical Complex in terms of documenting the progress of these cases, their needs, and he's very close to these children, very close to these victims, and they all consider him part of the family. So he's here to share with us, hopefully every week, few of the cases that they are dealing with in at Nasser Medical Complex. تفضل عمرو.
يعطيكم العافية. في البداية التعديل اسمه عامر طبش وليس بطش.
Okay, طبش. Okay, yeah, I knew there was something off with the بنغيرها بنصلحها ولا يهمك.
أوكي. في البداية يعطيكم العافية، يعني مشكور جدا يعني على هذا اللقاء وسعيد فيكم جدا. طبعا أنا بالفترة الأخيرة أنا كصحفي كنت بوثق حجم القصف والدمار والحجم المجازر اللي كان بيرتكبها الجيش الإسرائيلي بحق الأطفال العزل والمدنيين والنساء. نعم، كان حجم المجازر بشعة بشكل يعني اللي كنت أوثقه على مواقع التواصل الاجتماعي أو للقنوات التلفزيونية 1% اللي بيصير في الواقع. الصورة لا تنقل بشكل كامل ما يحدث في قطاع غزة. تمام. بالفترة الأخيرة بعد إغلاق المعابر.
منذر منذر can you mute echo? Go ahead, تفضل عمر.
بالفترة الأخيرة بعد ما إغلاق المعابر والسماح فقط لكرم أبو سالم بسفر المرضى، فأنا كصحفي كان في عندي مسؤولية واتجاه الحلقة الأضعف في قطاع غزة، وهي المرضى، الأطفال المصابين، الجرحى. الأمر لم يقتصر على الأطفال، في النساء، في الكبار، في الشباب كبار السن. فكنت من خلال منصات ومن خلال القنوات اللي بشتغل معها بحاول أركز على معاناة الأطفال المصابين، لأنه أنت بتعرف الأطباء عندنا كفاءة في قطاع غزة، وصمدوا وعملوا على مدار سنتين بأقل الإمكانيات وأقل المعدات الطبية، وكان في نقص حاد للعلاجات، ولكن كانوا بيواصلوا الليل والنهار حتى المنظومة الصحية ما تنهار، حتى يقدموا ما عندهم. تمام. ولكن للأسف الشديد كان النقص الحاد كان بيصاعد أو بيؤدي إلى سوء حالة المصابين في قطاع غزة، نظرا ما فيش إمكانيات ولا معدات ولا صور مقطعية ولا إشاعة ولا علاجات ولا أي حاجة. كنا بنحاول نركز على كل قصة طفل، نبرز صورته على وسائل الإعلام، نبرز معاناته في الكثير من القصص. في كل زاوية في المستشفى في قصة، في قصة لطفل مبتور، في فقد عين، وفي أصيب بالشلل، في كذا. الحمد لله تقريبا يعني من أول ما أغلق المعابر قبل 4 شهور لحتى الآن تم إجلاء من خلال القصص اللي قمت بتوثيقها ما يقارب أكثر من 60 طفل. بس هذا عدد قليل جدا، خاصة إنه الجيش الإسرائيلي فقط بس.
عمر الله يخليك. Let's try to translate so people understand. Dania, do you want to translate or you want me to translate? But anyway, I'll translate what he said, and Daniel, you can translate after that. So Amr is a journalist. He's been working at the Nasser Medical Complex. He took it a mission upon himself to document the cases of the injured civilians who've been severely injured at the hospital and waiting for medical evacuations over the past 2 years. He focused especially on the cases of children. He has a huge list of cases of pictures. Unfortunately, most of these pictures are horrific pictures. And what he says that despite all the work that he's doing, what he was able to manage or document is nothing to compare to the reality, because the reality is even worse. The number of cases is much worse. Many of the cases not even make it to the hospital. But out of the children, all the children that he managed to document, 60 of them managed to get medical evacuation out of Gaza for medical treatment. And of course, Amr, we see him in our groups. He celebrates for every child who finally manage to go outside to get the proper care. Most of these cases are severe cases that the colleagues in Gaza, unfortunately, after the destruction of the healthcare, are unable to take care of. So they try their best to stabilize these cases and wait until they get medical evacuations. As we know, there's almost 20,000 cases of severe medical injuries in Gaza that the healthcare system, the hospital there cannot provide for, who are waiting for medical evacuation, and that the agreement with genocidal Israel is to allow these cases to go out. But unfortunately, they are still making it very hard for these people. We are losing many of them every day. They are dying, waiting to be evacuated to get treatment. But again, he's happy that at least 60 of the children that he documented managed to get evacuated, get proper care outside. تفضل عمر.
يعني حجم او حجم او عدد الاطفال اللي انا قدرت ابرزهم على مواقع التواصل الاجتماعي، هو عدد قليل من حجم المعاناة اللي بمر فيها اطفال غزة. يعني كثير انا لفيت على المستشفيات، خاصة كان تركيز اكثر حاجة على مستشفى ناصر. كان حجم يعني الواحد بيتفاجأ او بينصدم من حجم او الكارثة من الاسلحة اللي كان بيستخدمها الجيش الاسرائيلي في قصف المنازل او كذا. كان هناك تشوهات او قطع في الرجل. مهما احاول اوصف لكم قديش حجم البشاعه اللي تعرض لها الاطفال من خلال استخدام الاسلحه المحرمه دوليا، من خلال تشوه من خلال تشوه من قوة الإصابة أو كذا، فجزء قليل اللي بنقول على مواقع التواصل الاجتماعي. بالإضافة هناك مئات آلاف الأطفال الذين يعانوا لحتى هذه اللحظة من حجم الإصابات، لأن إسرائيل بتسمح فقط تقريبا من 30 ل 40 طفل أسبوعيا. هناك أطفال من لم يستطيع الخروج، بل مرافق واحد يرفض الجيش بخروج عدد من عائلته. هناك يتم رفض لها أن يكون ابنها الرضيع، أن يكون لها مرافق. حتى في تضييقات ومعاناة من قبل إسرائيل في خروج عمليات الأطفال. إحنا من نحتاج في قطاع غزة لتحرك دولي للضغط حتى السماح بخروج أكبر عدد ممكن من الأطفال، لأنه كل يوم نفقد أطفال بشكل يومي. أنا قبل كم من يوم في خلال يوم واحد شغلت 3 مناشدات، ثاني يوم الأطفال كلهم توفوا نتيجة تأخير السفر. كل تأخير سفر عن الأطفال بيؤدي بحياتهم. أنا بشكل يوم.
خلينا
Okay.
نترجم. So Amr again is emphasizing the point that there are thousands of children who are severely injured in Gaza who are waiting to be evacuated to get proper treatment. And because of the delay tactics, because of the refusal of genocidal Israel from allowing these kids, we are losing many of them every day, many of these children and victims and civilians. It's even worse for the adults too, because while they allow a few children there, they're about 30 to 40 a week to go outside for treatment. They're not allowing any adult to go outside. So we are losing many of these lives only because Israel is not allowing to go outside and to get the proper treatment. We are not going to share images, Amr, today. We just wanted to introduce you today. But going forward, we will be having a weekly, talk about this with Amr, and maybe every week he can select 2 or 3 cases that he can present them. These are cases of severely injured children at Al Nasser Medical Complex who need urgent medical evacuation, otherwise they will lose their life. I know the connection with Amr might not be great, but this is just today we want to introduce Amr, we want to introduce the type of work he was doing, and inshallah going forward every week we will have him select the cases that he thinks are in most urgent need, and also get the required consent from them and from their families to be presented during the webinar. So عمر احنا اليوم بس حبينا نتعرف عليك ونقدمك هون للحضور. ما بدنا نحط pictures اليوم, but ان شاء الله going every week اذا بدك please join us, وحضر كل اسبوع حتى 3 الحالات اللي انت شايفها اصعب شيء اللي that needs evacuation, بعد ما تحكي معهم مع اهلهم انه it's okay to share their pictures and stuff like that. وشكرا لك على كل الشغل اللي اشتغلته والمجهود، واحنا بشهادة كل الأطباء والموظفين والمرضى اللي هناك كلهم بيحبوك، كلهم بيحبوا شغلك. ف يعني كثير شاكرين لك وشاكرين، وهذا مجهود رائع. التوثيق مهم جدا، وانه انت as a journalist to be the advocate for the child for the victim is really a very noble cause. تفضل عمر. you wanna close out with anything؟ تفضل.
اوكي، تسلم. يعني الله يسعدك. وكانت يعني من اسعد الفرص اللي حصلت عليها، وتحدثت ببعض القليل من الكلمات حتى استطيع ايصال رسالة معاناة الاطفال. ان شاء الله بتمنى لي خلال الايام القادمة بحاول كل مرة احضر 3 4 قصص من اللي بمر فيها معاناة اطفال غزة، سواء في الجانب الطبي او الجانب اليومي، ايش اللي بيصير في غزة، وانا جاهز بالتفاصيل ابلغكم فيها.
واحنا
تمام. بس
جاهزين.
بس بحب انوه
تفضل.
تمام. بس بحب انوه دكتورنا لشغله مهمه جدا. على الرغم من فتح المعابر في قطاع غزه، وهناك ترويج حتى على وسائل الاعلام الدوليه او الاسرائيليه انه تم فتح المعابر وادخال جميع البضائع واللحوم والكذا. للأسف الشديد لحتى هذه اللحظة يسجل هناك عدد من الأطفال مصابين بسوء تغذية حاد نتيجة عدم في نقص البروتين، نقص الحديد، نقص كذا، لأن هناك الكثير من العائلات في قطاع غزة لم تستطيع شراء اللحوم أو الدواجن أو المواد الغذائية. فبحب أنا وحتى هذه اللحظة هناك صور من غزة تخرج لأطفال مصابين بسوء تغذية. هذه الصور ليست قديمة بل جديدة، لأن هناك مئات آلاف المواطنين في غزة لم يستطيعوا شراء تلك الحاجات، وهناك حتى هذه اللحظة نعاني من نقص حاد في المعدات الطبية والعلاجات، لأن هناك في سياسة التنقيط اللي بيستخدمها الجيش الإسرائيلي بحق سكان قطاع غزة.
Yeah, Amr wants to make an important point, a final point today, that despite all the talk from Israel and the international community that they're allowing aid in, even to this day, 2, 3 months after declaring famine, there are children, there are civilians in Gaza who continue to suffer from malnutrition, from starvation, and to continue to present to the hospitals with these symptoms. So the amount of aid that is going in is not enough, and the quality of the aid also is not adequate. The pictures he's sharing, look at his phone, please. This is one of the children. These are new cases. These are not old cases. Even to today, look at the picture of his phone. Inshallah, next week will be able to share the actual pictures in a more professional way. So Amr is warning that aid and nutritious food and good quality food, especially for the children who are suffering from malnutrition, is still not going in. Israel is using the same tactics of delaying and continued genocide by other means, by starvation, by disease, by using the weather, the cold, as a means of genocide against people who have no shelter, people who have no homes, no tents. They are not allowing. Do you want us to share these pictures عمر؟ بدك ايانا نشارككم هاي الصور؟ مسموح نشاركها ولا لا؟
صحيح، أنا شاركت على في جروب هيدي الطفلة بيان. خليني
طب
أعطيك
اسمع،
بس تفاصيل.
حطها بالجروب، واحنا we will share it in a minute, okay?
تمام. هذه الطفلة بيان صقر عمرها تقريبا 10 سنوات.
This child, her name is Bayan Sakar, she's 10 years old, and she is presenting with symptoms and signs of severe malnutrition. إذا حطهم بالجروب، بالواتساب جروب, and we will share them if you want.
تمام، ولا يهمك، الآن بشاركها.
Do you have consent from her؟ عندك مسموح من أهلها ومنها إنه نشارك
تمام
الصور؟
تمام. جميع أنا الصور والقصص اللي بنشرها على الجروب يا دكتور كلها ماخذ موافقة مسبقة من العائلات بالمشاركة.
Okay, so Amr always makes sure he gets consent from the family and from the children to share their pictures. So while you prepare the pictures and share them, I'm gonna go and talk to Monder, see what's happening in Beit Lahia, and
والله
we'll come back and talk to you, Amr. Monder.
والله الانترنت الله وكيلك كل شويه بفصل، ما صدقنا شابكين من الشريحه الالكترونيه. I am
Yeah,
extremely suffering to get internet signal here, and you breathing oxygen, but for me I'm breathing to get internet signal. That is my current situation in Gaza.
okay, so what else is going in Beit Lahia? What projects you're trying to do? Some projects there, I think.
I am trying, as the brother Abu Hamza he mentioned. I was listening to him, and he mentioned the correct project should be done in upcoming days to install a solar panel system in north of Gaza, as we really in need of electricity as much as the sun, so we can get electricity from the sun. And we have a solar panel available in the market so far, but we need your support to provide us with the funds to get this solar panel system. And that way we can get also internet signal, get some electricity, and get water, because with this solar panel system we can make a water system work as well. So that time will give opportunity for the life to return back to north of Gaza, as now, as he mentioned, it was like an earthquake happened and destroy everything. Nothing left actually in north of Gaza, only rebels. So that is an appeal and confirmation to brother Abu Hamza that he is the correct when he asked or when he appeal to get a solar panel system in north of Gaza. Not only one place, maybe we can do this project in several places in north of Gaza, so many people can benefit from there. I am still in south of Gaza. That is my current situation. I can't go back to my village where I was staying, or where is I born and raised in my village Beit Lahia, because they consider Beit Lahia, half of Beit Lahia still under yellow zone, and this is dangerous place. And is even, he mentioned about the hospital that is still out of service. He mentioned about that there's 2 hospitals out of service there, Indonesia Hospital and Al Auda Hospital. That is the current situation. We are have many challenges, especially of electricity, getting internet signal, clean water, and we are still struggling with food as well. That only some trucks coming to Gaza. They never, as you know, Israel never respect any promise to implement the second stage of a ceasefire. So we are struggling. We looking for any hope that we can continue the ceasefire and complete the second stage of a ceasefire. During that time, we can return back to our village, and we can fix whatever we can, or we can replant again our farms in our village Beit Lahia. So that will be also my focus project. As you know, I born and raised in agriculture area, where my dad and my mom and my family members working in agriculture. So I'm planning to focus on agriculture projects. So the first step to make life in our village or our city, or the places that we can go there, as I record yesterday a video from there, is to install a solar panel system and start to replant the farms there and retain life there. Once the people see there is people working there, there is some projects are implemented in that area, the people will be returning back and give them hope. They've give them a power to stay there, and that time they will return back to their places, because they can find a water, they can find people. They are coming back there and with making some project, such the project that we are planning to make, which is agriculture one. This one will give opportunity also for many families to work in the farm, to make job opportunities. And as you know, many families, uh, they don't have any job opportunities. So that will give opportunity for many families to work in the farm, to get income, and survive with your support, your fund, your project or our project that we planning to make in north of Gaza.
So please donate to DAG Relief. We need to fund these projects. The projects in Beit Lahia with Munder is, they have the land. The area is known for agriculture, for farming. We would need to help the people to go back to their land to, grow their products and to become self-sufficient. We don't want them to be dependent on aid all the time. At this point, the most crucial thing they need is the solar panel to provide energy, to be able to get water out of the well that already exists there, that in Beit Lahia.
That's
For
right.
our brother Faris, they want to start a medical point, and also they need that solar panel to provide energy for the medical point, and we need to dig a well from zero in that area to provide water for the medical point and for the the civilians around. So please donate to DAG Relief or any DAG link. We need to help these projects. We need to help the people, survive in the north after they went back. We need to provide for them that will enable them to stay there, because if they cannot have access to water, if they cannot have any medical care or access to, medical help, they might, choose to go back and be displaced again. And these people are already exhausted and they have been displaced many times, and we need to help them find the means and support them, find the means to survive wherever they are. And now we have, I know we have many guests, but we can go back to talk to you, Munzer and Abu Firas and Amr.
Thank you.
But
Thank you, ma'am. Thank you so much for giving me this opportunity, and I will keep you updated. And inshallah.
do you want to
Doctor,
share the video?
and he has very bad connection and no electricity. Dorothea?
Oh,
Yeah, I'm using this mobile phone so you can see my
yeah.
face. So that's
So we have
how I can get that's how I'm really suffering to get
Yeah.
internet signal. I'm using many SIM card, and in the same time, actually, I give the owner of this cafe extra money to just allow me to be here and to be connected to the internet, to share my story or to share how we can access to the internet. And that's an example for the families in Gaza. It is extremely difficult to see the
Yeah.
word or explain what is going on in Gaza or what is the challenges. Even the war is finished, but we are still suffering to share our message or share what is going on in Gaza.
Yeah, thank you, Munzer. Now we have Dr. Ahmed and Dorothea. It's a tough competition now. These two people are very dear to us, very close to us. Dr. Ahmed Al Farra, we're happy to see your picture again, hear back from you again. It's been a while. And Dorothea is our colleague from Canada who is on her third mission to Gaza. She's currently in Gaza. She is the director of development at GLIA. GLIA is a nonprofit. It's a sister nonprofit from Canada that has been helping in Gaza. Actually, GLIA was established in Gaza in 2012. Dorothea and her husband Tariq, they have been really working hard to help the people there. It seems that Dr. Ahmed connection is tough, so maybe we'll go with Dr. Ahmed. If you please, Dorothea, be patient with us. Are you okay, Dorothea?
Yeah, I'm okay.
Yeah, so thank you. Dr. Ahmed, ahla wa sahla, welcome back.
Assalamu alaikum wa rahmatullah.
Wa alaikum assalam.
Good evening for everybody. Thank you for this webinar. It's a long time that we didn't meet you, my friends, my colleagues, Dania, Iman, Mariam, Roxana, Karama, Elvis, Marta. I don't want to miss anyone. Thank you, my friend. Thank you for this webinar, and we will not forget Dr. Nidal and Nidal also, and Ashraf and everyone. My friend, sorry for being late because the fuel is nearly consumed in the hospital. So they told us that they will turn off one of the engine. So our floor is administration floor. So they advised to cut off the electricity because it is not essential for life saving for like pediatric ICU or neonatal ICU. So I asked them, please, I have to join my colleagues in America. They told me that we will make a connection from the other floor, and that's what happened. Today was amazing day. Today was celebrating of the one of the Faculty of Medicine in Gaza, Islamic University. It was amazing celebration because one of the members of American Doctors Against Genocide, Azzeddin Lulu, was graduated today, and he has a nice presentation. He took nearly 5 minutes, but it was a very valuable presentation and comment. I hope that Dr. Azzeddin was with us, but I think he was celebrating now. It was something between drama and between celebrating, because he lost all of his family, and they up till now they are under the rubble, and now he has the force and he has the intensity to continue and to graduate and to be celebrating and to be proud about his graduating from Faculty of Medicine of Islamic University. I hope that we can provide you, my colleagues, some record about that celebration, because it was amazing. It can support our colleagues outside Gaza, that Gaza is always alive, always green. Gaza, no way to die, no way to surrender. Gaza is still fighting and fighting and challenging that doctors are graduating from Faculty of Medicine. So, in that celebrating, I was sometimes looking for the doctors. They are looking for the future. They are looking for to complete their study. They are the elite of the Palestinian people. They are the highly records in their study. They are working in unbelievable circumstances, in a tents, in no electricity and no internet. They used to came to the hospital to take some internet or to take some electricity and to take their lectures. Dr. Anwar Sheikh Khalil talk about their special circumstances in that war, that they lost nearly 2 or 3 students from Faculty of Medicine. He talks also about they lost near 3 or 4 of the committee of the Islamic University of professors like Dr. Omar Farwana and others who were killed or who were martyred in this criminal war. But also he mentioned about one time they were in a hospital and they were doing an exam. I think the hospital was in the eastern area of Gaza, and suddenly they were targeted by bombing. Dr. Anwar told us that he get out from the rubble, and he was have a tie and a jacket like to be smart in the exam, but he was full by rubble, and he get out and he asked his student to go to another hospital to continue the exam. This is unbelievable. Unbelievable. When I hear that, I know exactly that these people in Gaza are amazing. They are fighting, and they will fight. I think no one can counteract or can strike or can over the Palestinian in Gaza. I want to talk about the hospitals. My friend, in brief, the hospitals, nothing changed before and after.
Before you talk about the hospitals, Dr. Ahmed, we want to congratulate you. We want to thank you as a faculty. We want to thank all the doctors, the healthcare workers in Gaza, that despite all the difficulties, you managed to continue to provide for your students, for your patients. We are the family of Iz, so we need to celebrate his graduation. For those who don't know, Lulu is a medical student today. We heard the news from Dr. Ahmed. He graduated from medical school despite all the difficulties, despite losing his family. His father, who sent him to medical school and wanted him to become a doctor, unfortunately is not there to celebrate with him. His body continues to be under the rubble. Lulu, as an example of the students, of the healthcare workers, the doctors in Gaza, and the people of Gaza, is an example of extreme perseverance, extreme dedication to life, to health. Despite all these problems, he established the Samer Foundation that has been providing for almost 800 other medical students. Despite this, he managed to continue his study, despite all the difficulties, taking courses online and wherever they can, volunteering at the hospitals to be able to graduate. And this is really a memorable day that despite all this, they did manage to graduate. We really, all of us here, we want to congratulate him. We are his family. We consider him our son, our medical student, him and his colleagues, and we are proud of you, the faculty, Dr. Ahmed, and all your colleagues who continued, despite all these problems, to educate and to teach these students and to bring them to this point. And I really want to open all the panelists to speak and congratulate and clap, maybe for you and for Lulu. I know Izz is busy today with his celebration, with his graduation, but inshallah we'll have him next week and we will have him share his experience, and maybe we'll have whatever speech he gave you today seems to be very impactful. So we want to hear it live next week, inshallah. We're not gonna let this pass. So everyone, please open your mic and let's give a round of applause to Dr. Ahmed and Izz. Open your mics, please. Open your mics.
Congratulations.
Thank you.
Thank you. Thank you.
Beautiful, beautiful.
Thank you, my friend. Thank you. I want to mention, Dr. Nadal, that while Dr. is talking and he make his presentation, what is the flag in his presentation that he make some projects to donate and to help all the students in the Islamic University and the other universities like Al Azhar's and all the students in Gaza. The Dr. Anwar Sheikh Khalil, head of Faculty of Medicine in Gaza, told us that Dr. Izz is without telling anyone or without reporting that for anyone, that he's helped in some financial issues belongs to these students without these students to know about that. Also, what I'm most surprised about him, that he's talking that he's thinking to help the people outside Gaza. He think to help in Sudan. He think to help in another area. I told him, please, as we are the most mankubin fil alam, the worst in the world. So what I mean that they have open heart. They have kindly They are amazing. They are amazing nearly. They want to help everyone. They want to share the donation and charitable everything with everyone. My
So,
friends,
despite all the difficulties, we want to celebrate the small successes that are only possible because of your extreme dedication to life, to medicine, to health, to humanity. We are really grateful. It's beyond words. So thank you. And we are very aware of his work. We are working with him, and we know he's helping more than 800 students to finish, their education. And he has projects to help them not just with their tuition and their schooling, to even help their families with aid, with relief, with food. And we've been working with him. He's a very, very hard worker. And I think the people of Gaza, you are teaching all of us, you are teaching us life, you are teaching us medicine. And you and Dr. Iz hopefully will be the leaders of medicine globally. And as you said, you are going to be sharing your experience with other affected communities, whether in Sudan or in Congo, because the situation, the circumstances that you went through, and you managed to survive and to provide despite all these difficulties, are actually lessons learned that we can use, we can benefit from them as a global medical and healthcare community that we can implement in other places. So this is huge. This is a big day, and thank you, Dr. Ahmed. تفضل.
Thank you, Dr. Nadal. Actually, my friend, today we have the meeting, weekly meeting with the administration of Nasser Medical Complex. We are discussing about our plan in the next year. So we are looking for more evaluation for the 2 years that spent in this war. We are looking for making some progress in the achievement or the performance of the hospital. You know that Nasser Medical Complex is the only castle nowadays that found in Gaza. We lost nearly all the hospitals, but now Nasser Medical Complex, God protect it. Inshallah, it is the only hospital that it is working in the all specialists and subspecialists. What I want to mention today, and all my colleagues were talking about, that doctors nowadays in Gaza, they are extremely exhausted. They are tired. They need to be evacuated outside Gaza for some time, like a vacation or something like that. But no way to do that. I told them that we, among this war, we noticed that some doctors, unfortunately, they become desensitization. What I mean by desensitization, that sometimes from the mass casualties and the lot of victims and the blood in the floor and the number of victims on the reception room, they lost the reaction because they nearly like someone who's confused. So nowadays, we sometimes notice that some of our doctors, if he has a baby with some congenital anomalies, he don't want to resuscitate because he know that this baby maybe he will not survive. I will make my effort and my equipment and my drugs to save it for another baby. What we are talking now is to remove that desensitization and to again to do our best for everyone, to try to save everyone and to deal with everyone. This is the first and the main in our plan in the next year. And I think we are going to do some subspecialties and the training. We try to invite a lot of doctors. I'm talking in pediatrics, pediatric cardiology, and pediatric rheumatology, and pediatric neurology, and pediatric pulmonology and gastroenterology. We are working on endoscopes, bronchoscopes. We are working also on EEG. EEG is available, but we are looking for AMG and nerve conduction velocity. We try to make Nasser Medical Complex is the capital of medicine in Gaza until all the hospitals in Gaza come back again and be in their normal situation. My friends, we still suffering. We still have lack of nearly for everything. Nothing enters as we expecting after the ceasefire agreement. We thought that everything we will get inside smoothly, like special formula, like electrolyte, like arterial blood gases, kits, like protein in CSF, like some central line for neonatal ICU and for pediatric ICU, like salbutamol nebulizer, like budesonide nebulizer. But unfortunately, nothing come from these things. We still fighting. We still asking from here and there. But we have to mention that what belongs to food, the better is the situation is better than before. Nearly all the food, like rice, like sugar, like oil, vegetable oil, everything is coming nowadays, and the price is acceptable. But the only lost is the protein. All the kind of protein is lost. No egg come inside, no fish. If meat and the chicken is come inside, it is frozen and it's very expensive. Yesterday on a Friday, the people in Gaza and the West Bank also, and even in the Arab countries, they used on a Friday to do some food that it is called fatta. They try to do chicken on some rice or something like that. They used to do that. So I asked it about chicken. The 1 kilo was 100 shekel. Nearly, we are talking about nearly $30. If you want to buy two chicken, that means every chicken will nearly cost $100. So you will buy the cost of the food for a family. It nearly costs $200, and this is unbelievable for situation in Gaza and the lack of money and currency of money in Gaza nowadays. Egg is completely absent. Yogurt is completely absent. Fish and all kind of protein is completely absent. So I want to mention that the cases of severe acute malnutrition, like Sam, they are the marasmic one are nearly recovering, but the kwashiorkor is not recovering because they need the protein. They are worsened nowadays. They have edema more and more, and they have lack of protein more and more. But we will try. We will do everything to help them and to try to save their life. This is the usual situation. On the I think nothing changed. Also belongs to the tents and belong to the evacuated patient or evacuating people in Gaza and in Khan Yunis. Nearly 350,000 people come back to Gaza, but the medical situation of the hospitals is very difficult in Gaza because Rantisi Hospital is nearly destroyed. and Shifa Hospital is also unable to come back in the same situation. So the situation medically in Gaza is very difficult. So we have to support in this time Gaza City to support the people there. I think IMC is nowadays they have some plan to make a hospital in near Al Azhar University and Islamic University in Al Katiba area. They are looking for to do a field hospital, and they promised that they will supply it by CT and MRI and some equipment that it is lost in Gaza. I hope that they will succeed. This is will alleviate and make the situation is better. That's what the conclusion in Gaza nowadays. Again, thank you, my friend, and thank you for your time. And last 2 weeks or 3 weeks, I tried to get inside to see you, but Karama told me that I'm on the incorrect link. So and now we are in the correct lane. Thank you again. Thank you for everyone, and have a good day.
Thank you, Dr. Ahmed. You always make our day. Go ahead, Karama.
Most
Yeah,
welcome.
there was a depressed mood. Every week you were not there, the depressed mood goes down and down. So you are our SSRI.
Thank you, thank you, thank you, Karama.
Thank you for everything you do, and everybody is so grateful for the description of the graduation celebration of Iz. As we all care about him, and we care about all the students in Gaza. So we really appreciate you, and don't forget us. Please come every time. Charge that phone beforehand. And I have to ask you, where do you want to go for vacation?
Still the same thing?
Chicken?
For vacation.
No, not vacation. What's that? What's that concert you want to go to?
Yes, we have to go to Netherlands.
Why? Who's there?
With Luta.
How about we bring him to Gaza?
Karama يعني promised to invite us, and she's bought the tickets.
I got you, Dr. Al-Farra.
But we have to get out. This is the most problem.
Let's make a trade. Let's make a trade. You invite us to Gaza, bring us to Gaza, and we will invite you anywhere else you want.
Wallahi, يعني this is
you have to go on vacation, and we take over and work.
Exactly. You need a break, so we need to come in and give you a time.
Wallahi, if you come to Gaza, I think all the people of Gaza will celebrate about your coming, because you are our heroes outside Gaza. You are 2 years. You didn't feeling tired. You are ongoing helping and supporting Gaza, and this. Sometimes one of us feeling tired. This week I am tired. I can't join. But you are continuing that among 2 years. This is unbelievable. You are our heroes, Dr. Nidal, Dr. Karama, and everyone in that meeting.
Allah يسعدك يا رب.
Thank you, Dr. Ahmed. واجبنا مقصرين, and we are all exhausted. You are exhausted. We are all exhausted. But giving up is not an option. That's why we keep going, and we keep going because that's our humanity. That's our job as doctors, to care and to continue to provide despite everything. And honestly, we're learning from you guys. You are teaching all of us how to continue, even in the most unimaginable situation, in a most live stream genocide in history. Despite all of this, you come here and you still have the smile. As despite losing his family, still manages to graduate. Mr. Faris, despite losing his son, in the line of duty, continues to come, continues to build, continues to insist on helping his people. So, I mean, what we are doing is nothing compared to what you are doing, guys. You are our heroes, our role models. Dr. Ahmed, if you please, we want to go to our colleague, Dorothea, Dr. Dorothea. from Gaza. She's on her third mission. She's with GLIA. Lucia, sorry about the delay, about the wait, but we consider you one of us. So we always give priority to our people from Gaza, from Sudan, from Congo. But Dorothea, you are Canadian, you are DAG, you are GLIA. So go ahead, Dorothea, share with us what do you have, because you are there in Gaza now on the ground. So we really need to hear updates from you and your assessment of the situation.
Okay, thank you for having me. I can't figure out how to turn my camera on. I don't know if that's anything that somebody can help me with, because I wanted to.
Yeah,
Oh, there we
need
go.
the camera.
Okay, hi. Okay, thank you.
Almost.
Yes.
Where are
Okay,
you?
yeah.
Oh, wow. Okay, good. Yes, we
You
need
can
to
see
see your
me?
camera.
We can
Yes,
Okay.
see.
we hear you.
Okay. So yes, this is my third rotation into Gaza. It's been a year since the last time I came in. My journey back in was very challenging. I'm sure many people on this call are aware that trying to get into Gaza at any given moment is very difficult. And this became especially more difficult after the Israeli military took the Rafah crossing on May 7, 2024. After that happened, medical delegations, which is part of one of my tasks, I bring healthcare workers into Gaza. Medical delegations began to rotate through Jordan. And so teams arrive to Amman, they connect with all of the internationals that are going into Gaza. They travel through the colony of Israel, and then they go into Gaza from there. And what that means is that the Israeli government is in complete control over who can go in. So just as much as they are controlling the aid that is going in, they're 100% in control of the people going in. And after the Israeli government took complete control, the percentage of healthcare workers, so these are people who are part of EMTs, the emergency medical teams that come in under the WHO, the World Health Organization, the percentage of healthcare workers that have been denied rose to 50%. So nearly half of every single person that applies to go in is denied. And no one is ever given any reason why. I myself attempted re-entry. So when I went in twice, it was through Rafah. And then I applied again this April of 2025 to go back. I was denied. I applied again. I was denied. So I hired a lawyer and I filed an appeal. And it took about 5 months. And the Israeli military came back and said, okay, she can reapply, but there's no guarantee. She comes to the border, she gets interrogated, and then we decide. And that's exactly what happened. So on Thursday, I arrived to the Allenby crossing, where I was interrogated by Israeli border security and ultimately let in. In that process, they manipulated my phone, which rendered it unusable, but I brought in a burner, so I wasn't concerned about any information getting into the wrong hands, let's say. But this is a perfect example of a microcosm of the impunity with which the Israeli government behaves, because we are healthcare workers, we are aid workers, we are coming in to dispense humanitarian assistance, and it is against international law for the Israeli government to behave this way. And for me, because it's been a full year since the last time I came in, it was a very stark contrast. I was in Gaza, in Rafah initially, back in 2024, and I was there and I watched as 900,000 Palestinians evacuated as the Israeli military began its invasion. This time, when I entered, it was through Karam Abu Salam. We drove up the Philadelphia corridor toward the sea road, and Rafah is gone. It's gone. It no longer exists. They have erased Rafah. And by the time we got to the sea road, it was dark, so I couldn't quite see much of anything. But there's a vibe, and there was a vibe. Many people on the street, but I couldn't see into the distance. But over the last 2 days, with the light of day, I have seen the complete annihilation of the Gaza Strip, and that word annihilation keeps circling in my head, but it does not capture the absoluteness of the devastation. There is buildings collapsed onto themselves that are no longer recognizable for what they once were. It is a 360-degree view of hatred, because it is only hatred that could fuel such destruction. It is. I'm still processing it, to be honest with you. I just came in on Thursday, and I'm still trying to make sense of it. And I think I'll probably spend the rest of my life, much like everyone here, trying to make sense of all of this. Now, as I've come in, I'm just going to talk very quickly about two specific things that I'm working on. So firstly, there's the healthcare element, but I'm going to skip to the second thing first, which is the question of ecocide. So because I come into Gaza, I do see that as a privilege, and I try to take advantage of every opportunity I can to collect testimony. So during this trip, I am working with local journalists to collect testimony of farmers to talk about the struggle of what it takes to make this land usable again. So I've spoken to farmers who have told me about how the land, so especially around Khan Yunis, was filled with olive and date trees that the Israelis, when they entered and occupied the land, they destroyed most of the trees with bulldozers and tanks. And those families who had been displaced took those olive trees and had to use them for firewood. Camps were put in place of where those olive groves once were. And they're telling me about how they make every effort they can to make this land a space where they can grow things, but they're faced with a complete inadequacy of supplies. But farmers are telling me how neighbors are pulling together to bring the remains of existing equipment that is broken in order to make it usable. So for example, a destroyed barrel of water is melted down to make another barrel of water. So they're trying to reuse what they have. And we talk about the health effects of this. The health effects of this are palatable, excuse me. The soil contamination is a very serious concern because especially in the Khan Yunis area, there's no known testing of the soil contaminants, and the land itself has been targeted by airstrikes, by phosphorus, by other kinds of munitions and bombs. But then there's the kind of unspoken health effects because the amount of work that is required to restore this land is tremendous. And some of these farmers are older and they really do require assistance, but they can't afford to pay anybody to help them. And so their own bodies are breaking down to try to produce the food to feed their families and their displaced neighbors. And another significant challenge is water. There's not enough water for crops and there's not enough water for people. And one farmer said to me, yes, our crops need water, but we're not going to water our plants at the expense of our neighbors who are thirsty. So continuously, every single day, despite the efforts that people are putting into bringing life back into the land, they are continuously met with challenges as a result of this violent genocide and this brutal military siege. So I'm trying to capture those testimonies for both record-keeping purposes. I'm a historian by training, so it's very important to me that the narrative is correct, and also to elevate the voices of those who are traditionally marginalized. The second main project that I'm working on is within healthcare, and what we do with GLIA is healthcare building capacity. And what we specialize in is essentially medical devices, so producing medical devices within low resource areas. And in fact, GLIA as an organization was born in Gaza through the creation of the world's first, and I'll see if I can try to show it to you, 3D printed stethoscope. So this was actually created inside Gaza. It's hard with the screen to show you. To get around the issue of the blockade back in 2012, because medical devices even back then were not getting in. And so it was produced using local printers. And if you can see the tubing that you would traditionally see in the stethoscope, this was actually pulled from the back of a Coca-Cola machine inside the Gaza Strip, because some of you may remember there used to be a Coca-Cola facility. And just to give you some more added context to that, the next major device that we produced was a tourniquet. So this is we call it the Gaza tourniquet. It was created here during the Great March of Return in 2018, when thousands of Palestinians were shot for peacefully protesting the illegal and unjust occupation. And now during this genocide, we've turned our attention to external fixation. So this is what I'm currently working on. So external fixators, for those who are unaware, are typically applied to people who have like crush injuries, which we saw a lot of during this genocide as buildings were collapsing on people. And this is a type of injury where a simple cast would not be enough. And so it's a device that's placed on the outside of the limb in order to secure it in place and to help it heal. The problem is the blockade. So much like no food, no water, no supplies, that also obviously includes medical equipment like external fixation. We teamed up with an organization in Western Europe to produce this component of the external fixator, and this is the clamp. The rest of the external fixator is made out of steel. These clamps are impossible to find here, but the steel rods are not. And so we, working with local surgeons at Al-Alhi Hospital, we devised this particular clamp, and they successfully put it on the first patient at the end of August that we're currently monitoring. His leg is fully healing. We're going to get the final X-ray this week, and we're hoping to do 5 more tests, 5 more patients, before hopefully implementing it more wide scale. The objective here is not necessarily to replace existing external fixation. This is a project of technological emancipation. We're not going to end the blockade. We're not going to end the genocide. But at the very least, what we can do is we can allow Palestinian healthcare workers to be co-producers of knowledge and to create devices that work for them that do not rely on the blockade. And so that's what I'm currently working on now.
That's amazing. Wonderful. This is really empowering, Dorothea.
Thank you. Yeah, I think so. It's we're all really excited that this could be the start of something really good.
Fortunately, the people of Gaza are very resourceful. They will always find a way. And sometimes, just putting brains together can come up with solutions that give back dignity and give back independence. And, one of the projects that we are still hoping to finish is the rebuilding of part of Al-Shifa Hospital. And it has been put on hold a little bit because of all the attacks and all the blockades and all these things. But the idea from that rebuild is to use things that are found in the rubble and recycle them, make hospital beds, make hospital stands and tents, and create a hospital ward that works for the people in Gaza, by the people from Gaza, using whatever they can put their hands on. So the blockade is illegal, is unjust, is genocidal. The Israel holding control of the borders is the most outrageous thing that can happen. You can imagine that, once the ceasefire ends, all gates should be open for aid to come in, and that is not happening because they are doubling down on their genocide. So we do what we can, we continue to put the pressure, and that is really a strong call from me to everyone who is listening to our webinar. Our work is not done. A ceasefire is not the end of the work. It's first of all, it's not a real ceasefire. Second of all, it did not happen without the public pressure. And if we let go, we will lose all the momentum that we have built. So this is the time for us to continue working together, to continue pushing our public officials, to continue pushing for aid to get in, to continue looking at the root causes for why this even happened to begin with. Why does Israel have impunity? Why is there no accountability? All these things are the root causes of what happened in this genocide. And this is what we need to push for. We need to change the reality on the ground. This is not acceptable. No human should accept it for another human. And that is the appeal of Doctors Against Genocide. We should not just rest and think our work is done. Thank you.
Thank you. I don't know if do you still have Dorothea or?
Yes, I'm here.
Yeah. Okay. Yeah, this is really, really empowering, as you mentioned, as Karam mentioned. We need to continue fighting to end the blockade. We need to allow everything from outside to go in. We need to free the victims from the knee of the perpetrators because as long as they continue to be at the mercy of Israel for anything that goes in, this means the genocide machine continues by other means. The most important act for us as a medical community, as a global community who cares about stopping genocide, is to free the victims from the aggressors, from the perpetrators. And as long as Israel is the sole, entity that controls all of this, and as long as the international community, including the U.S., accept this, and even the regional Arab countries accept this as part of the solution, this means that the genocide continues. We are not really changing the dynamics. We need to reach a point that the genocidal system in Israel is dismantled. We need to reach a point that the Palestinian people in Gaza and the West Bank, in Palestine 48, there is a genocide in Israel, in Palestine 48 also. The people there are going through a genocide by, pressuring them in tiny corners of their land, by instigating these gangs that are killing our people in Palestine 48 every day, with full support and awareness of the Shin Bet and the Israeli security agencies. So we need to reach a point that all these systems of genocide are dismantled. The perpetrators need to be held accountable. The victims, the Palestinian victims in Palestine, all historic Palestine, need to be free of the genocidal Israeli machine and mentality. But what you're doing is really very, very inspiring, Dr. Dorothea. We really applaud this, and we're happy to support. And as you said, the people of Gaza continue to find ways to fight the annihilation and extermination campaign that's imposed on them by Israel, whether through improvising ways to survive, and finding ways to make their own medical supplies, medical equipment. This is really great. Which hospital are you located at now, or which area? Khan Yunis, you said?
I'm in Deir al-Balah.
Oh, Deir al-Balah. Okay, perfect.
Yeah.
Are you in Al Nasser, Dorothea?
No, Deir al-Balah.
No,
Oh,
Deir al-Balah. Yeah. But speaking of Shifa, I visited Shifa today.
Oh, you did?
Yeah.
How's the situation there?
It takes your breath away in the worst way.
Yeah.
Yeah.
So
Sorry,
compared to what was the situation last year, what do you see the situation now in Gaza? Is it worse? Is it better? It's the same? Because you've been there 3 times. What do you think?
Yeah. It's much worse. It's an apocalypse.
Wow.
I truly do believe that we're going to invent new words to describe the level of destruction that exists in the Gaza Strip. Because nothing, at least no words in English, can capture the level of horror that exists and has existed here for decades, but what has been accelerated over the last 2 years.
Yeah, we hear that a lot from our colleagues in Gaza, that even the word genocide and war crimes, crimes against humanity, do not even come close to capture the amount of hatred, the amount of extreme psychopathy that commissioned all these crimes against the civilians.
Yeah, and they're tired, right? Everybody is tired, and in comparison to previous times and to the previous quote unquote ceasefire, nobody really believes it. I will say another thing, and I don't like to romanticize people, and I don't like to be very what's the word I'm looking for? Defeatist. But one of the things that is strikingly different from the last time is the last time I was here, the sky was full of kites. Kids flying kites littered the sky. And it was truly one of the most sincerely beautiful things I've ever seen. And it was this incredible juxtaposition of life versus the machinery of death, where you would have these plumes of smoke from these missile attacks in the background with these these skies dancing in the foreground. I haven't seen one. I haven't seen one kite. And the absence of that sight also took my breath away, because I think that means something too. And this is 2 years of everyday trauma that is going to require a lot of support and solidarity within our lifetimes. Like this is our fight for the rest of our lives. That's how I see this, truly.
That's how we see it too.
Yeah.
That is it too. It's just like the amount of destruction, the amount of damage that has been inflicted on the people of Gaza is endless, and it is on us to mitigate every way possible.
Yeah.
I mean, they were trapped. There was no exit, no way to run away, no way to go anywhere. The sick, the poor, the hungry, the starved, the injured, under bombardment for 2 years. Multiple nuclear bombs worth of bombs were dropped on Gaza. It's just stunning.
Yeah. Okay. I think growing up in Palestine, I mean, I remember the first time we were forced to be politically aware of what's happening was in the 80s, early 80s, 1981, 82, when Israel invaded Lebanon and attacked the Lebanese people, the Palestinian people there. And there was the siege they imposed on Beirut in 1982 for 80 days. There was actually a song after that. You know, the president came up with a song, 80 يوم ما سمعناش يا بيروت. For 80 days, Israel was imposing a siege on Beirut, on the Palestinians, their civilians, without food, without water. And during those 80 days, no government in the world intervened to help the civilians except for, issuing empty statements. So we grew up into this in 1982. And we thought that 80 days without intervention from the world to dismantle this criminal entity was too much. Coming to now, Gaza has been under bombardment and siege for 800 days. From 80 days in 1982 to 800 days now. Actually, this week is 800 days. So this proves that the criminals, genocidal entities, as long as they're not held accountable, their crimes continue to get worse. So over the last few decades, with all the talk about peace and peace resolution, stuff like that, none of this really helped. As long as the perpetrators have all the power, their crimes continue to get worse. So the amount of destruction, bombardment, and siege that they visit in Gaza is at least 10 times or even more worse than what it was in 1982. It was 80 days, now it's 800 days of siege and complete blockade and destruction, and we continue to allow it. So there is a history. The pattern of genocide is very well known. Actually, if you study it in a scientific way, you can, with a scientific precision, predict what is the outcome. Genocidal entities, genocidaires will never do the right thing out of their own moral compass, moral insight, because they don't have it. They lack it. They don't see the other as a human being worthy of, rights like anyone else or worthy of life. We really need, as a medical community, to continue to do all what we can to hold them accountable. And as long as they don't pay a price, as long as they are not held accountable, as long as they continue to be the sole, as you mentioned, Dorothea, this is very important. I cannot imagine that the world is still allowing Israel to control every loaf of bread that goes in, every doctor who goes in, every nurse who goes in, every tourniquet that goes into Gaza. I cannot imagine that the criminal who are committing all these crimes is also the one who has the final say of, yes, we can allow it or we cannot allow it. This should be rejected, right of hand. It should not be even an option. And all this talk about opening the blockade and getting, forces in and all these things, it simply is not coming to fruition. The victims continue to suffer. Genocide continues. Maybe the number of bombs is less, but the death continues by all other means. And as you, Dorothea, a witness of this, Mr. Faris, and everyone else is a witness to this, that people there, I mean, winter is coming, they have no tent, they have no shelter, they have no good quality food. Amr, we can share, if you want to share the pictures that Amr shared. The child just came to the hospital now. We're not talking about 2 months ago when the genocide, when the starvation or the famine was, declared. To this day, children are presenting to the hospitals with starvation and, signs of starvation. Um, and while some basic food, which is like mostly carbohydrates with low nutritional value, are coming to the south of Gaza, the north is not getting anything, and no part in Gaza is getting the good quality food, nutritious food that can help mitigate the consequences of starvation. Add to that also the medical destruction, the lack of supplies. I mean, just the fact that Dorothea and her team has to invent ways to get an external fixator, which is like just a basic tool anywhere else in the world. Just the fact that we're forced to do this is a testament that the genocidal entity should not be the one controlling everything that goes into this. The international community should intervene. Israel should be completely removed from this equation, and it should be the United Nations, the regional powers, and everyone else stepping in to get the real help, the relief that they need. I know, and until we get this, until we, are able to dismantle these structures, we continue to do all what we can to help these victims, whether in Gaza or in Sudan or in Congo. So please, everyone, try to donate, try to spread the word, share our links for donations. We have the links in the chat. All these communities need urgent help. Please donate to GLIA, donate to DAG, donate to any organization that is helping there in Gaza. I know this is like a drop in the bucket, a drop in the ocean, but anything, even helping one child, one victim, one patient is better than not helping anyone. Again, it's never going to be enough or adequate, but at least we need to do something to save as many lives as we can. Anyone else now? Should we go with a round of feedback, Krama, or reflections?
I just want to say one thing, that while the ceasefire negotiation have been happening, what is happening in the West Bank has been really brutal. The attacks by the settlers, the pogroms, the burning of the cars, the burning of the olive trees, the theft of the olive trees harvest has been accelerated to a great degree. People are not safe. People, the Israelis and the settlers are acting with complete impunity. Not a single Palestinian is safe in historic Palestine. Not a single Palestinian
Yeah.
is safe.
They just also approved 2,000 new settlements, the Knesset. So we
2,000
all know what that means.
Wow. I heard 30,000 units. 30,000 units were approved. So the genocide continues. The genocide, the Palestinian people continues full force and with impunity so far.
Mm.
Okay,
let's do the round.
Yes. Okay, so we'll open the floor for some reflections. Dr. Ashraf, are you there? Ashraf Abulaz? Ashraf
Yes.
has.
Yes, I am here. Yeah.
So tell us, what's your reflection, what you heard today about the genocide, Sudan and Congo and Gaza and West Bank and Palestine, 48, everywhere.
Yeah, I want to start by saying that I'm very pleased to see Dr. Ahmed Al-Farra again in our meetings. It has been a while since we have seen him. And I would like to congratulate all the medical students from Gaza for their accomplishment. I think Gaza, the people of Gaza, astonish me every day. I mean, it's endless. I can't say enough about the kind of admiration and appreciation for what they are doing. When you have this kind of genocide unheard of going on, and you have medical students graduating from medical schools, this is amazing. When they are coming with new inventions in the medical field that's probably going to be used by the rest of the world. This is amazing. This is beyond I can imagine. And when we do what we are doing with DEG or GLIA or PAMA or any other group that tries to help, we are helping ourselves. Actually, we are not helping them. I mean, we are helping them, but we are helping ourselves first, because in face of all these atrocities, we feel guilty. I mean, I personally feel guilty every day that I can't do more. I can't do more. I wish I was there. I hope I will get there in January with PAMA, and I'll meet Dr. Ahmed in person and get to show him my appreciation in person as well, and with everybody over there. Those are the heroes, not for Palestinians, not for Arabs, not for Middle Eastern. Those are the heroes of the world. I mean, they are not liberating themselves, they are liberating us. Us as the thank you and thank you and thank you again. I can't tell enough how much I'm thankful to get to meet them in person in these meetings. Dr. Ahmed, Mundir, all of you guys are our heroes. The second thing is that, inshallah, we will be starting today a state. We have our Zoom meeting at 7 p.m. Eastern time. Dr. Karama is kind enough to join us to give background about the history of DEG and what's going on. And hopefully we can do things at the state level, maybe the same in terms that DEG does on the national level in terms of fundraising, in terms of talking to our representatives in the State House and the State Senate, and hopefully it will be beneficial. But every act, whether it's small or big, I think it makes a difference. And like what Dr. Nidal said at the beginning, that this ceasefire did not happen because of the hearts of those terrorist states and their supporters. It just happened because of all the pressure that had been put on them from everybody with conscience around the world. Thank you, and thank you, and thank you again.
Thank you, Dr. Ashraf. So yeah, Dr. Ashraf is leading the group now in Indiana, medical community in Indiana, and they have their first meeting today. We were happy to be there. Thank you for all what you do, Dr. Ashraf. And I don't know what's your secret, Dr. Ahmed. Everyone likes you. Everyone wants to have a special meeting, special connection with you. You're stealing, yeah, you're stealing the thunder of DEG. I mean, yeah, I'm glad we have
Dr.
you here.
Farra is DAG.
What?
He's DAG.
if he agrees to يا ريت ترضوا كمان. تفضل.
I will not leave until you finish, because I really يعني reevaluate myself after that meeting, and even I charging the energy to be full by that meeting. Thank you, Dr. Ashraf. We really appreciate your participation and your representation. And I want to tell you, my friend, that as there is heroes in Gaza, you are also heroes. You are talking loudly. You are sometimes there is some one of the government or of the police. They are trying to challenge you. They are trying to Last time we have our colleague from Netherlands who wrote about Guillain-Barré syndrome in Gaza, and her boss tried to punish her and try to talk with her that you are belongs to Palestinian. So again, you are doing a great job and a great work when you are supporting and when you are talking without fear, and you are put your demand on God, inshallah, because God will protect both the people in Gaza and outside Gaza. Thank you, Dr. Ashraf. Thank you for your support. You are our heroes outside Gaza again and again. Thank you.
Thank you, Dr. Ahmed. Now we go to Maisa. Maisa,
Thank you,
you've been to
Dr. Ahmed.
Palestine. Maisa, you have been to Palestine back and forth, and you are close to Palestine, about to go in again. Tell us, what do you have?
Yes, so I actually just had a random webinar with Techno Park, the group of tech. It's a tech incubator in Palestine, and guess what this topic was? It's about from tech to solutions, and obviously the threat that technology has on all of us. I was very happy to see the level of awareness among our tech talent in Palestine, especially when it comes to surveillance, and we know what technology has done to us. I mean, this genocide has been so multifaceted. It's not just the human hands and the machines, it's also the technology that's been deployed against us. Yeah, so things in Palestine, as you probably heard from other speakers, it's not only the surveillance, but you walk into Palestine. I honestly cannot. If I were to drive between Nablus and Ramallah, I cannot recognize the roads anymore because everything has changed with the new settlements, new roads, literally like the Israeli flag everywhere on the roads. It's horrifying. And to get into a city like Nablus, Jenin, actually Tulkarem, it's all sieged. Nablus has 5 checkpoints. This is like a genocide in the making, and we better be, on the watch, right? I think I'm sure we talked about that. It's now is the time to double down on our efforts, and resistance comes in many forms, and we need to all be united against this horrifying machine. Now we also know what happens with impunity in Israel. This genocide against the Palestinian people means it's going to be the same in Sudan and Congo. So honestly, it's really terrifying, but I think we all see it and we all know, what's coming. And I think we should all unite to fight this, horrifying machine. The other issue in the West Bank is, as you probably know, that there's a huge problem right now with the economy because a lot of people work for the Palestinian Authority that have not gotten any salaries for the past few months. So economically, people are suffering. There are families that literally have no money for food. So we need to support them as well. And sadly, a lot of the young generation has been working for the Israelis as workers, and since October, the whole youth has lost any income opportunity. So that combined with siege, combined with the lack of control of any resources, what goes in, what goes out, the West Bank can be starved in no more than a week because every little village, every little city, everywhere in the West Bank has a gate on it. This is I don't know how many checkpoints in the West Bank, but we're talking probably 1,000. So, and then the settlers, of course, have been absolutely vicious in their attacks, and they have absolute impunity. So the situation in the West Bank is a genocide in the making, and we need to be on the watch, and we need to intensify our efforts to protect our people in any way possible. Sorry, I couldn't be more positive. It's grim, but
Yeah.
knowing what we're dealing with is the first step, I believe, in confronting it. And we all have a duty to do that.
Yeah, thank you for sharing this, Maisa. And yes, it is a genocide that is happening in the West Bank too. Actually, when Dag called it a genocide, it was before October 7, and it was about the situation, what's happening in the West Bank. And thank you for also bringing up the economy of genocide. This is part of the plan that has been put in 100 years ago to deprive the indigenous people, the locals, of their means of living, of their land, or to control their economy, so they become dependent on the occupier, they become dependent on the perpetrator for their lives, for their jobs, for their work. And this means they can turn it off anytime they want, and they can turn it back on anytime they want, to leave the victims at a complete dependence on the perpetrators. This what happens with, because the Palestinian economy used to be an independent economy. The people used to, plan their lands. They have their, local merchants, local manufacturers that did not need Israel. But with time, with their strangulation on the Palestinian economy, nothing comes in without their permission. Nothing goes out without their permission. Even the water, their control on the water is a tool of genocide. They're even using water as a tool of genocide. Their complete control on the water system, the underground water in the West Bank, in Palestine, in Gaza, is also a tool of genocide, because people need water to take care of their farms, for their products, for their produce, and Israel took a complete control of this. So people cannot, plant their land. They cannot make their own food. They cannot, have their own small businesses or small factories. All of them became dependent on working inside Israel with construction and other things, which means that Israel can choose when to turn this off. And this is what's been happening in the last 2, 3 years, that no one's allowed to work. And even the Palestinian taxes, the tax money that comes to Palestinians from their own, imported goods, has been confiscated by Israel and not given to them. And usually this was a huge amount of the budget of the Palestinian Authority that used to give people their salaries, the teachers, the nurses, the everyone who used to work with the municipalities there. They're not getting salaries because those tax money has been confiscated and frozen by Israel. So that's very important.
One other thing, Nidal, I
Okay.
think
Yeah.
it's really important to note is what I'm seeing every time I go to the West Bank is that like they're creating these little silos, right? Like if you live in Nablus, you're very insular, you have a very insular living. So you don't really know what's going on in Tulkarem and Jenin and the rest of the West Bank. And I think that's all by design. It's to really disconnect the Palestinians from each other so that we do not have the same kind of levels of solidarity and empathy with each other. And it's all part of the design. People in Ramallah have a very different experience than the people in Nablus, Tulkarem, Jenin, and then the refugee camps that are going through an active campaign of erasure. It's just unbelievably like accelerating. And so this is genocide, and sadly it is accelerating, and it's part of the plan that we must confront together. And actually, in terms of the water supply, I know that in the West Bank, you have to go through Israel to get a permit to build a water collection well in your own residence. You have to go through Israel, even in areas that are controlled by the Palestinians. It's really strange that you have zero control over the resources. So what does that mean? That means that it's full on occupation, whether they call it annexation or not, they actually have the full control, and we're just at the receiving end of their aggression and their expansionist project.
Yeah, unfortunately. Yeah, we have a lot of work to do. We barely did anything yet. Mr. Faris, are you still there? Faris, Abu Hamza?
السلام عليكم.
أهلا Faris. If you want to share anything at the end, final remarks, آخر شيء كلمات أخيرة. I know it's late there for you. I want you to give any final comments or something before you leave. إذا حابب مداخلة أخيرة لأنه بعرف متأخر الوقت عندك. إذا حابب تحكي أي شيء بعد ما سمعت كل الحكي، إذا في أي مسج final message you want to give to the people، إذا في رسالة أخيرة يعني.
أنا بحتاج دكتور نضال، يعني بده واحد يترجم.
أنا بترجم لك، يلا تفضل. إذا عندك مداخلة بالأخير، بعرف الوقت عندك متأخر، الدكتور أحمد بترجم لك. أنت والدكتور أحمد هلا، أنت شمال، دكتور أحمد في خان يونس، فترجموا لبعض.
حياك الله دكتور أحمد. الفرة، بارك الله فيك، حياكم الله. يعني كلمة أخيرة إن شاء الله رب العالمين. أنا كثير في حديث يعني حابة أتحدث عنه، خاصة معاناة المسعفين وضباط الإسعاف وما تعرض له من ظلم كبير وقهر في مدينة غزة. أيضا يعني المأساة لن تنتهي كما تحدثت بوقف إطلاق النار. هناك في قطاع غزة الآن يعني، وأكيد الدكتور أحمد يشاهد هذه معاناة الجرحى. كثير من جرحانا لا يجد قطعة الشاش حتى يتم الغيار على الجرح. هناك كثير من الجرحى يبقى بالأيام بسبب عدم توفر الإمكانيات السبلايز بشكل عام يعني في قطاع غزة. الحل الوحيد يعني هو تدفق المساعدات، المستشفيات الميدانية، الوفود الطبية، الأطباء. هناك عدد كبير دكتور نضال تم قتله من قبل الاحتلال الإسرائيلي، كفاءات وأخصائات وهامات وقامات في المجال الصحي، أطباء ذو اختصاص. هناك عدد كبير تم قتله، هناك عدد كبير خلف قضبان الاحتلال الإسرائيلي، منهم الدكتور حسام أبو صفية. الوضع في قطاع غزة وضع كارثي ومأساوي بكل ما تعنيه الكلمة. القطاع غزة يحتاج منا الوقوف والضغط على الاحتلال لفتح المعابر. لحتى هذه اللحظة الاحتلال الإسرائيلي لم ينفذ أي شيء من قرارات أو الاتفاق الأخير لوقف إطلاق النار، ومنها هو لحتى هذه اللحظة لم يفتح معبر رفح، وأكبر دليل لم يدخل لحتى هذه اللحظة حسب يعني علمنا أي وفد طبي. هناك قطاع غزة يحتاج لكثير من التخصصات المفقودة، وأيضا الأجهزة التي دمرها الاحتلال الإسرائيلي، وخاصة مثل مجمع الشفاء الطبي، ويعد من أكبر المستشفيات في مدينة غزة. هناك كثير من المرضى يواجهون الخطر، خطر الموت، ويواجهون الخطر على حياتهم بسبب عدم توفر كثير كما تحدثت من الأجهزة، مثل قسطرة القلب الذي دمره الاحتلال الإسرائيلي في مجمع الشفاء الطبي. يعني الوضع الإنساني كارثي للغاية. يجب إدخال والضغط على الاحتلال الإسرائيلي بالسماح لإدخال الوفود الطبية و يعني المساعدات الطبية. هناك كثير يعني نسمع تقارير عن وزارة الصحة بنفاذ ما يقارب 60% من الأدوية وأكثر من مخازن وزارة الصحة. يعني ماذا يفعل المريض والمصاب الذي يعاني لحتى هذه اللحظة؟ كما تحدثت، كثير من المرضى أو من الأطباء أجبروا على بتر عدد من يعني أطراف المصابين بسبب قلة الإمكانيات. يعني لو في إمكانيات، لو هذا الطرف وهذا القدم لم يبتر، ولكن بسبب هذا الحصار، ولا يزال الحصار قائم منذ عامين، ما يتم إدخاله من قبل قوات الاحتلال الإسرائيلي لا يلبي 1% من احتياج قطاع غزة، وخاصة للمنظومة الصحية. نحن نحتاج الكثير يعني عندنا.
خليني أترجم يا أبو حمزة.
تفضل
So
تفضل.
Abu Hamza actually, by the way, is a close friend to Dr. Hussam Abu Safiya. He was with his team, the paramedics, there with Dr. Hussam and Kamal Udwan Hospital until the last minute. And he's trying actually to go back and build a medical point close to that hospital. He is also wants to emphasize the plight of the people in Gaza, especially the medical community, the attack on healthcare, the detention, the torture, and also the murder of the healthcare. He lost his son in the line of duty. His son, Bara, Allah yarhamu, was Bara. How old was Bara, Abu Hamzi, when لما استشهد؟ 18. قديش كان عمره ولا؟
18.
So Bara Afani is Abu Hamza's son. He was a paramedic, and along with two other paramedics, they tried to to save a family in the north of Gaza, and they were all bombed, and everyone was killed, including the paramedics. So the paramedics are actually, I mean, all the healthcare workers are at the front line. There is a huge attack on them, but especially the paramedics, because they are the ones who go outside, try to recover and save the victims. So the attack on them is even more lethal. They need more support. So he's asking all of us to support more the paramedics in Gaza, especially in areas where there is no medical care. He is also saying that there is still the blockade. They're not allowing any medical equipment, any medications to go in. That many lives are being lost because the hospitals in Gaza don't have the right treatment, right medications. If that was allowed in, the right equipment, more lives could be saved. He's also saying that many people who lost their limbs and end up having amputation that are life, changing disabilities. Many of these limbs could have been saved if the right medical equipment and medications and specialties are allowed into Gaza in terms of allowing specialized medical teams, more medical supplies, more medications. So many of these deaths, many of these disabilities are preventable, and we need to add the DAG component. The whole genocide is preventable. Genocide as a disease is preventable. These things do not have to happen to start with. No one in Gaza or in Sudan or in Congo need to go through any of this. We need to prevent genocide from the beginning. We don't need to deal with genocide as a destiny, as a natural disaster. It's not a natural disaster. It's man-made. It's all man-made. It's all predictable. It's all something we can diagnose early on. As Maisa mentioned, the situation in the West Bank now, we can, we need to intervene to stop this before it escalates into mass killing and mass murder like it's happening in Gaza. So none of these victims should have been lost. None of these hospitals should have been destroyed. So this is really important as a medical community to step in and not just, resign ourselves to trying to provide some aid and relief after the damage has been done. We need to prevent this. Abu Hamza should not have lost his son. Dr. Safiya should not be in detention. None of these victims should have been killed if the world and especially the medical community did all what they can as a medical duty to prevent these crimes from happening. So thank you, Abu Hamza. Shukran ilak. And we're trying to do all what we can. I know it's late. I know your phone is running out of battery of charge. But inshallah, we'll have you every week get updates on the new project, and we will talk, see how we can provide you with a solar panel, and also to dig that well to provide water for the medical point and for the people there. Again, please remind everyone, please donate, please share the links, donate to any campaign in DAG or DAG relief to provide Abu Hamza and the paramedics and the people in Gaza and Sudan and Congo with the help that they need. أبو حمزة anything else؟ تفضل بدك تحكي شيء ثاني؟
يعني يعني أنا سعيد جدا بهذا اللقاء، وبشكرك دكتور نضال على هذه الفرصة إن أنا يعني بتكلم بين قامات وهامات في العالم، من أطباء وأساتذة، جميعا كل احترام وتقدير لهم، وإن شاء الله بنشوفهم عن قريب بقطاع غزة إن شاء الله. شكرا لكم
إن
كثير،
شاء الله.
والسلام عليكم ورحمة الله وبركاته.
عليكم السلام. شكرا لك. لا شكر على واجب أبو حمزة. Abu Hamza is thanking all of you for listening, for trying to help, and inshallah we'll stay in touch and get updates on his project, and inshallah we're proceeding to help him with this project, and he's honored to be with you guys, although as we say in Arabic لا شكر على واجب. This is
دكتور
the least
نضال.
that we can do. تفضل دكتور أحمد.
Dr. Nidal, I would like to thank my colleague Faris Abu Hamza. I would like to say for Maisa Alhamdulillah ala salama بعد زيارة West Bank. I would like to confirm about the situation in West Bank is very serious. يا جماعة, we need to invite someone from West Bank who's living there. in every webinar and every Zoom. Please, please, please. I'll try to invite my colleagues from Jenin, from Nablus, from Ramallah. What's happening in West Bank is more serious than happening in Gaza. Why? Because Gaza is under focus and under all the media are covering Gaza, but West Bank, no one is talking about it. What happening in the West Bank? In West Bank, you know that the settlement every day they attacking the people and they taking their olive and they're taking the olive oil. They cutting their trees. They are burning their cars. They do everything to fight them and to try to evacuate them from West Bank. My colleague from Jenin told me that a village near Ramallah, I think, I don't remember her name, that its name. He told me, yes, he told me that that village is full of villa and all of her owners are in America and they are afraid about the settlement to go to that village and to occupy it. So they ask everyone who's Palestinian in West Bank to sit in that villa without any payment or without any financial offer because they don't they want to protect it from the settlement and the gangs of settlement. The second point, Dr. Nidal, that we have mistakes, unfortunately, for our Palestinian Authority because they told the farmers if you want to prepare something, ask the settlement what is what they prefer to take. They told them that we need in this time we need aubergine, for example, we need stuffed aubergine, we need cucumber. So they depend completely on the settlement and the gangs of settlement what they want to buy from them. So this is make the financial and the commercial situation is completely depending on the settlement gangs and the settlement authority in West Bank. This is what we have to mention about it. The last thing that nearly 1,000 martyrs were in West Bank since the beginning of October. And this is against the propaganda that they are talking that everything happened after October. There is no October and 7 October in the West Bank, but they are evacuated from the West Bank without doing anything. That means that our issues is not from 7 October. We are talking about 1948 and for Balfour Promise. Since that, our judgment and our law is going on. The last thing for my people in West Bank, the last I have to say, أكلت يوم أكل الثور الأبيض. I don't know what the translation of it in English. Maybe Dr. Nidal will explain it. Last thing, my people and my friend in Doctors Against Genocide, you are heroes of humanity. Gaza is proud of you. Also, West Bank is proud of you. We praise for you and see in your reflection of an unbroken dignity. Thank you. See you, inshallah, next Sunday. I'm really appreciate your time. Thank you for everyone and have a good time.
Thank you, Dr. Ahmed. Next time in Gaza, inshallah, and the West Bank. And I agree with you, inshallah. We will have more speakers. We will have more speakers from the West Bank, from the communities there that are suffering under the blockade. There's a blockade there too. And also suffering from the settler violence, from the army, genocidal army violence. Maisa is going there, and inshallah, she is going to be making more connections. And we will try to hear more from our colleagues in Jenin, Tulkarem, مسافر يطلع, هيبرون, بيت لحم, القدس. We want to hear from our colleagues or friends in 48. I think every city there is also undergoing challenge. There are gangs that have been established by the Israeli security forces to go and kill people in Israel, in the West Bank. They've been doing this for the last few years. Every day they kill few people there and goes under the radar, and they blame it like they do here. It's like a black on black crime. There they blame it on the Palestinians, although we all know, and it's very obvious to everyone, that it is the Israeli, security and Shin Bet forces behind it, and they protect these gangs. And they are using this as a way to forcibly transplace or forcibly displace the people from there. They want to empty the 2 million Palestinians who live inside Israel proper. They want to make their life miserable. They want themselves to be scared for their lives. Many of them actually are leaving. And unfortunately, because of the USA giving Israel the free visa waiver, this is working in a way against the interests of those Palestinians because they are finding more ways to leave, fearing for their lives from these gangs that are supported by the Israeli security forces. So thank you, Dr. Ahmed. Inshallah, we'll hear more from people in the West Bank, and we will be in Gaza soon. I want to move to Iman and Dania. I don't know, they have been quiet. It seems they did not do anything the last week of importance to DAG except a major lecture for medical students in DC. Do you want to share what happened, Dania and Iman? We're really proud of you and thank you for being there. And it's actually one of the most attended lectures that we had. There was almost, a few hundred medical students there. Dr. Ahmed, can you mute, please?
But
Oh, yeah.
before I'm leaving, 1 minute, someone coming to try to say hello.
محمد اهلا وسهلا كيفك؟
عليكم. والله I tried my best to join. والله I couldn't.
You promised me you will join. What happened?
والله I promised, but today we are moving from Deir al-Balah to Khan Yunis. Well, my cousin is moving, so I was helping him with moving his stuff all the way from Deir al-Balah to Khan Yunis. It took us around 5 hours to move the things, and it was so hard and complicated, but alhamdulillah, at the end of the day, everything was okay.
يعطيك العافية. No worries.
الله يعطيك.
Do you see how
إن شاء الله لقاء طويل.
Muhammad, do you see how many hearts came on the screen when you came here? Did you count? I mean, it was
many
full
what?
of hearts. Do you see how many hearts on the screen?
Yes, I have a lot of followers.
Yeah, this means next week. We want to hear from you next week. Keep your promise next week. يعطيك
إن شاء الله
العافية.
والله إن شاء الله I will do my best. إن شاء الله next week we will be there إن شاء الله.
في كل الحب هذا إلك.
Wow. Thank you so much. That means a lot to me. Inshallah, next week we will speak together, inshallah, about a lot of things that happened last month. It's so interesting, inshallah. It's gonna be so interesting.
Inshallah, next week Karama will visit us in Gaza.
هذه كبيرة.
She will teach us about how to read EEG and nerve conduction velocity and electromyography. Inshallah. I saw that. Inshallah, as soon as possible. And all our colleagues, inshallah.
Muhammad, stay safe, Allah khalik. Be careful. We want to hear from you next week, inshallah, okay?
إن شاء الله.
يلا بالسلامة إن شاء الله بالسلامة. نسمع من إيمان ودانيا.
Oh my God, totally made my day. I got to see Muhammad. I got to see Dr. Ahmed Al-Farra. Like,
yeah, today's our lucky day.
I'm full. My heart is full. Mashallah. So assalamu alaikum. Dania and I were fortunate enough to speak to the students for our national health plan. I don't know, Dania, I think there might have been at least 150 students there. It was really pretty amazing. We spoke to them about genocide, like the role of the healthcare worker to report, to to lend a voice to genocide, our role for prevention. We talked a lot about like what the UN definition is versus like what the medical definition is, and what DAG has been doing at the UN, and and in South Africa, like to urge this like medical definition and creating a medical board, because we can assess genocide before it becomes genocide. In the legal framework there's all these little nuances and political things and stuff, and then we did an update on what's going on in Gaza, and so they were really happy to have us there. They had been wanting to have someone there talk about Gaza, and it was just pretty incredible to talk to the medical students and hear their experiences on their campuses where they've been trying to get people to come to speak on Gaza, and at the very last minute, those talks getting canceled on them. And so we're hoping that we were able to get some more folks to join us and stuff. But I think Daniel will agree with me. Like these students are our future, and when you hear them talk, they they have so much motivation, and they don't care about the possible repercussions. They see that something wrong is happening, and they're putting their educations at risk. So I don't know, Danny, if you wanted to say anything else, but I thought it was really, I think we need to continue to do more outreach to these students.
Yeah, no, I agree. I think initially, like how we were told this event would be, it would be like a lunch hour, and people would kind of like flow in and flow out. And apparently, and when we walked in, it was a full house, and everybody was so eager to hear from us. And we learned how much work actually went into them getting this 45 minutes dedicated to what's happening in Palestine. And just the medical students came up to us and thanked us, and we got to hear stories of resistance that they're engaged in. And I know these medical students, the repression, and they're being strangled, and they're audacious enough to believe like there's a better future out there. And just to hear like everything they're going through, I do think that there needs to be more outreach to the medical students, because like Iman said, they are the future. And they do wholeheartedly believe that a better future is possible. And like I said, they have that audacity. And I think it's that audacity that people fear. But it was really nice to hear that the resistance is not dead amongst the student movement, and they're doing kind of whatever they can. They're organizing. One story we heard out of Ohio State was they were supposed to have Dr. Nick Maynard come speak on their campus, and last minute, the powers that be kind of canceled it, and then they quickly like organized and had him speak at a local church, and this was all done by the medical students. So very re-energizing. It filled both Iman's and I's cup to hear from them, and shout out to them. They worked a year on making sure that the genocide of the Palestinians would be center focus of their national summit. And we met students from all over the US, including Puerto Rico. So yeah, it was special.
Thank you so much for presenting, Dania and Iman. We're very grateful for the two of you, and you have done an amazing job. So thank you, and thank you for reporting back. This is great.
We need the pictures and the slides of your presentation. It was very impactful, so we need to learn from you. You are in the front line, and you're right. We need to invest in the students, because the students are the future, whether they are in medicine or any other discipline. But for the medical community, we need to invest in them. This is a defining moment for medicine. And as we always say, Gaza is going to free us all, liberate us all, and redefine how we approach the global community and our professions. And we are learning every day from our colleagues in Gaza. And this is something that we want to invest in the students to do.
And something I just like to add too is we were not policed at all. We were given free reign to say whatever we want and to just go forward. And that's something else that we appreciate, that people approached us after the presentation and said to us, thank you for being so candid. Because I think in order for us to have I feel like there's a lot of dishonest conversations happening around Palestine, and I feel like in order to create any serious change, any structural fundamental change, we have to have honest conversations. And something I just wanted to comment about the West Bank is, I know a lot of rhetoric coming out of the Trump administration, and there's no annexation. Settlements can be approved without annexation. So just because Trump and his administration are saying no to annexation does not mean that settlements are not being approved as we speak. And the scary thing about what's happening in the West Bank is this is the land that they feel biblically, that the Zionists feel biblically entitled to. They don't care about Gaza. They're okay with like just leaving the Palestinians there and just like, militarily occupying it. It's East Jerusalem. It's what they refer, it's the West Bank, which like a lot of people in the Trump administration are trying to change West Bank into Judea and Samaria. It's that parts of the land that they feel biblically entitled to. So I think we really have to buckle harder and triple, double. I don't even know the vocabulary, but like I think what can happen in the West Bank is really way more scarier than what we've seen unfold in Gaza. So I call on everybody to just, this is a very critical part, and ceasefire is, there's no ceasefire. We can't let them return. We can't let the people in Gaza return back to the status quo. And then we can't watch the people of the West Bank lose their land because we didn't work aggressive or hard enough in Gaza. So yeah, thank you.
Yes, we need to implement all the lessons that we learned from Gaza and the West Bank and anywhere else, any community that's vulnerable, that's been genocided, and all the precursors of genocide that we have been learning about. If we really need to make an impact, we have to intervene now before it escalates into the mass slaughter that we all witnessed in Gaza. Again, thank you, Dania and Iman. Dr. Mariam Shitab from California, what do you have today, please? Dr. Mariam?
Well, it's getting colder, and when you read the UN's reports and bi-weekly updates, we're not getting any tents, any housing supplies into Gaza, just like we're not getting any food or fuel in. And I feel like we're all going to need to brace ourselves for yet another winter of children dying of hypothermia in these, you can hardly call them shelters. And so I don't know. I mean, like sustained calls on our representatives to really follow up the 5 million ways that the Israelis have failed to honor their end of the ceasefire, with not letting any food, any supplies in. I think there's something like a 90-something% denial rate to the NGOs asking to, bring anything in because they're saying you're not authorized to bring stuff in. It's just like when you read the UN reports, you just realize evil can be so mundane and bureaucratic. Like, I think they have now, or someone correct me if I'm wrong, but I think they have now rerouted any aid trucks coming in from the Kerem Shalom crossing to like another route, which takes them through like the Philadelphia corridor and like this like coastal road, which is like completely damaged and not at all sufficient for these aid trucks. And you're just like, all that was a route change, right? And it's going to lead to even less aid trickling into Gaza, and all they had to do was change the pathway for them. It's like it's only going to get worse. So people have to like not let up. Like I'm looking at, well, I don't know. It's been a weird week, right? It's like the images coming out of Fasher, and then also still trying to, sustain the necessary attention for here. And it's kind of horrifying. I feel like I measure my weeks in which horrible images and videos are burnt into my retinas. Just like they're saying that 300 women were killed after Fasher fell, like just within 48 hours. and you have all these images of mothers clutching their children while they're being threatened with guns, and like these psychopaths just laughing in the background, and it's like it's I feel like it's like a exercise in figuring out how much the mind and the soul can kind of tolerate seeing all of this stuff come out. I don't know.
Yeah. Thank you, Mariam. Martha, are you still there? Sorry, I have to go to Martha before she leaves. Martha? Martha, are you still there? Martha has been doing a great job in Boston,
I'm
especially
here.
especially reaching out to the church community. She's been doing an amazing job. She and Krama are opening their own organization in
We're going to
Boston,
start a new Catholic church.
and it's gonna be a Catholic DAG. So tell
Catholic
us more.
Dag,
Any
Catholic
updates
Dag.
on this?
I know that Karama's too modest, but I was at an award dinner with her last night. Just want you all to know she got a Massachusetts Peace Action Award. So
Thank you.
I just wanted to add quick. Sorry, go ahead.
This is a collective award for all the doctors, the medical workers who speak up and who lead in the fight for others. So it's a collective award.
Yes, yes. I just wanted to say what a great webinar. This is amazing. And I feel like I have so much more clarity on all the different projects that we're doing, and now to be able to speak to people and get money, and the new projects, the one, and to hear from people in Sudan. That was really amazing, and I'm just so grateful to have ways to channel the horror that we've been seeing to do some kind of help with it. And so happy to see Dr. Ahmad. I've been missing him immensely. Also, I think well, just to say that to get clarity on the project was so helpful, and to also the doctor from Canada who's in her second stint,
Dorothea. Yes.
Dorothea, what an incredible, powerful testimony to hear the stark contrast of what you're seeing, Dorothea. Powerful. It must be very hard to absorb. And I'll see many of you on the 19th, and tune in to the Catholic place, the presentation on the 12th, if you can. It's going to be live streamed, and if you can't do it, then it will be available on the YouTube site.
Can you tell us more about it, this upcoming event at the Catholic Church in Boston, please, that you helped organize?
It's a parish. Karama spoke there a couple of months ago, and I pushed to have a second round, and adding to Karama this time, Anthony Aguilar will join us, and Claude from the Congo work, the Rwanda, will also join us. And so it's going to be kind of like a testimony and panel and questions. Yeah.
So do you have special connections to the Catholic Church, to the Pope, to the people up there?
Direct.
Exactly. Yes, please. We need your help. Use your spells to connect us more.
Spells. Okay.
Spells.
We need orders. We need orders from the sky to stop genocides, to save the humanity, please. If you have
That's
any
right.
connections there.
I'm on it.
Yeah.
Isn't that what Dr. Stanton was telling us in South Africa?
Yeah, yeah. That actually, as much as the medical community is important in this, the religious community, all faiths, they also need to mobilize. They need to have a more robust mechanism to interfere, to make sure we stop these crimes. We make peace all over the world between all these different faiths and communities and ethnicities. So unfortunately, I mean, the status of the world now is a testament of our collective failure But again, it is not a failure if we learn the right lessons, if we institute the right mechanisms, if we establish the right organizations to make this never again for everyone and never again anytime. That's all what we're trying to do with the help of all of you guys, and especially the students, the young people, the young generations, because we don't want to inherit this dysfunctional, this anti-life global community to them. Arusa, are you there?
Yes, I am. Thank you so
Arusa,
much.
Dr. Arusa
Yeah.
Ibrahim from New York. She also was at the UN with Daniel last week. If you want to give us any updates, any reflections, how did the session with the UN Rapporteur for the Right to Health go? And what lessons did we learn? What can we do more to
Well,
make
yeah,
more?
I think Dania spoke a bit about it last week, but I mean, the report was mainly right to health for healthcare workers specifically. And I mean, I read the report. It was a bit absurd, you know, while they're undergoing a genocide, you're talking about right to health, where I mean, basically, it talks about how over 500 healthcare workers are detained, abducted and detained, 1,600, more than that now, of course, killed. Many of them have been targeted and killed along with their families. So, I mean, these reports are it's a bit kind of mind-boggling while there's an act of genocide going on, because it should encompass right to dignity, right to food, right to having their families not killed. So we talked a bit about that. We talked about the medical definition of genocide and whatnot. Um, but yeah, there's so much more to it. Other than that, I think we met a few medical students who have been actively wanting to be involved, and they reached out to me again for talks, hopefully in the next few weeks. I just wanted to add the the webinar is such a unique platform to bring people from Congo, Sudan, Gaza, everybody who's actually suffering, witnessing. Um, I'm not aware of any other platform that does that. So thank you for this. And it's amazing to see Dr. Al-Farah. And congratulations to Iz um, and all the medical students who graduated. In terms of New York, today I'm probably some of you are aware, today is the New York City Marathon. It's there are 55,000 runners from all over the world, from 150 countries. The title sponsor of the marathon is Tata Consulting Services, which is an Indian company which supplies drones and surveillance equipment to the genocidal entity. The majority of the runners, people who participate, were cheering. It's very annoying because I'm very close to the track. Are not aware of that, and there are several areas where there are organizations have set up spots where they have banners and they're asking to at least bring attention to it and then drop Tata as their main sponsor. And this is not new. This has been going on for decades, and the whitewashing of these companies that are actively involved in genocide, but people, thousands of people are cheering on it. So that's it from me. Thank you so much.
Thank you, Arusa. And there is also elections coming up on Tuesday for the mayor of New York. This is a historical election, so anyone who knows anyone there, please, you know who to choose. You know who's the candidate who deserves to win, so please do all what you can. People can vote starting today, so I mean the voting already open, so people can vote early. This is important to help the candidates who spoke against the genocide, spoke against the injustice to win, versus the candidates who do support genocide and who actually volunteered to defend the war criminal Netanyahu, the perpetrator of the genocide. So the difference is stark. You cannot even come to to make any similarities, any parallels between the two. So please try your best to make a difference in New York. Anyone else, Karama? I think
Roxana.
Roxana did not want to speak. Oh, she's here. No? Okay. Next time, next week. Dorothea, do you have any, if you're still there, do you have any closing remarks, Dorothea?
Can you hear me?
Yes, yes,
I
we
told
see
you,
you.
Dorothea,
We know
for
it's late
our,
there. Sorry about that.
she was
Yeah,
worried
that's okay.
that at hour 2 there would be no time for her. And I was like, no.
It's okay. Thank you. Yeah, I do want to share one last observation if I can.
Yes, please.
And it's come from my observation of working with healthcare workers who have gone to Gaza to volunteer. And it's something for the last 2 years. And it's something that I've kind of in the back of my mind, I'm calling the Gaza phenomenon. Because what I'm seeing is this pattern where people often from the West, especially North America, they go to Gaza and they come back transformed. And many of them will describe it almost as a religious experience. And for some of them, it is. Some of my own delegates, in fact, after going to Gaza, have converted to Islam. But even for those people who are untouched by theology, it's a profound spiritual transformation. And I've been trying to understand this, maybe because I'm an academic, but what I'm seeing is that for these people who are raised in that culture, in that North American culture that is shaped by capitalism, where nearly every aspect of our lives is commodified. We've commodified relationships, we've commodified healthcare, we've commodified morality. Gaza offers a radically different lens on the human experience. In the West, we're taught to interpret life through ownership, through productivity. We're taught that money equals power, but it's an illusion. And when you go to Gaza, when you're embedded in the community, you see that illusion begins to crack. It is one of the most materially impoverished, most systematically misrepresented places on earth. And healthcare volunteers, the ones that I've been working with these past few years, you know, they're encountering a people who have been relentlessly dehumanized. And yet they still live with profound dignity, with community, and with resistance. And it becomes very clear when you're here that it isn't comfort or convenience or consumption that defines life here. It's community. And what I think many of these people are discovering, myself included, is that the human experience doesn't require endless consumption. It doesn't require things. It requires truth. It requires dignity. It requires relationship. And this discovery is intoxicating. It really is. It's an addictive thing. And most healthcare workers who have come to volunteer in Gaza immediately want to come back. And I think that's why. I think that's why people come back, and I think that's why they long to come back, because in Gaza, we find the one thing that has been eluding us, which is truth. And that is a highly addictive thing.
Wow. Very profound. And I think we all feel it. That's why we cannot get enough of being with the people from Gaza. We cannot, it's, you know, there is a sense of duty, but there is also a sense of we want to belong with them. We do not want to belong with the other side. We do not want to belong with the people who do not care. We want to be the ones who care and who actually spend everything, all our energy trying to make a difference, a positive difference, so that we can be worthy of that community.
Yeah. And I feel like leftists in the West, we like to intellectualize community. But all you have to do, and truly, and I don't mean to romanticize, because the situation here is really bad, but all you really need to do is come to Gaza and you'll understand community.
Yeah, this is profound. We're gonna close on this actually. Let this sit in, and this is a call for everyone. Do not forget the people in Gaza, our colleagues in Gaza, the people in Sudan, El Fasher, El Congo. We have a lot of work to
Do
do.
not let the people of Gaza forget you. That is the most important thing. Do not
Yeah,
let the people of Gaza feel you did
exactly.
not do what it takes.
Yeah, I really think we always worry about being blacklisted by, Zionist organizations, but in truth, we should worry about being blacklisted by the victims of genocide, because that will be the worst blacklist in the world. When the victims themselves label you as a supporter of genocide or as indifferent to genocide, indifferent to their suffering, that you watched all of this and did nothing. I think this is the worst, the most incriminating blacklist or labeling that any one of us can get. And I know we've been trying everything we can not to be on that list. And we're inviting all of you, and I'm sure anyone who's still with us on this webinar, 4 hours into the webinar, are already on the right side of history. We just want to invite more and more people to this circle to save them from being labeled as apathetic or indifferent, because silence kills. The biggest, the strongest weapon that the perpetrators of genocide have, the perpetrators of imperialism, capitalism have, is the silence of the masses. If the masses move, if the masses refuse to be participant in this, all these crimes, all these genocides, all these injustices in the world will stop. We need to remember that we, the people, hold the power, and they are using our silence, the silence of the masses, as their biggest and strongest weapon. It's more actually brutal, it's more efficient than the F-16s and F-35s and all the weapons that they have. When we, the people, whether we are in the West or in the East or North or South, stay silent and indifferent to the suffering of our fellow human being, wherever they are, especially when this suffering is being funded and supported and aided by our money, our taxes, our weapons, we should not accept this. We should do everything we can to stop this, to create a better world, and each one of us can do something. There is no excuse for anyone. If you cannot do too much, you can do little, but any action, big or small, does help. And
I
I
want to
think,
share one
Further.
thing.
Yes.
Several members of Doctors Against Genocide are now in New York, or is it DC? At the American
DC.
DC, at the American Public Health Association meeting, and here they are. Just gonna share. Can you see?
Oh, yes. Yes. Oh, familiar faces.
Yes, they are standing against
Danny and
genocide,
Deep and
representing. Yeah.
Athena. Yeah, that's great. Yes, keep working, keep doing all what we can. We need to be everywhere, guys. We need to claim these spaces, and as we always say, cede no space, not even mentally. We need to be everywhere. We need to transform everything and to fix all these institutions that their mere existence is the reason why this genocide and these genocides have been allowed and enabled. Because if the institutions, whether they're universities or hospitals or healthcare institutions or governments or regular organizations, did the right thing, if they did what they should have done, all these conflicts should have been solved a long time ago without having to lose countless numbers of lives of children, of mothers, of fathers, of hospitals, of healthcare workers. None of these crimes that we see every day is something that was supposed to happen. Every single one of them is a preventable loss. We, as people who go to school to study medicine to save lives, should not forgive ourselves for allowing all these losses to happen in front of our eyes. These are not natural disasters, as we said. These are all man-made. These are all intentional. These are all, done by design for the benefit of some supremacist countries or nations or politicians, some war profiteers who are exploiting not just our resources, they're exploiting our lives for their benefit just to make more money. We're really honored to hear from Dorothea. Her reflections are so powerful. I myself always try to understand why do the doctors who go to Gaza keep insisting on going back again. Now I think we have a clear understanding and explanation of what happens. It's the sense of community, the sense of being there with the victims, the sense of being there with the truth, the sense of all of us that we long to be on the right side of history and do all what we can. And I think the closest place for us to feel this sense of righteousness is to be there with the victims themselves. Any final comments, guys?
Thank you. I think we can
So
say
hopefully
goodbye
this
to
coming
everybody.
week, yeah,
Inshallah.
hopefully this coming week we'll have good news from New York, from DC, from everywhere, from Gaza, from Sudan, and we'll see you all next Sunday, inshallah.
Inshallah.
Okay, guys. Thank you. Thank you, everyone. Thank you. See you next Sunday. Thank you.
مع السلامة دكتور أحمد.